Colleagues, you have to mute your phones. There it goes. Someone just muted their phone. Thank you very much. With that, colleagues, is there any suggestions, additions, deletions, items onto the agenda?
Speaker,
Yes.
Speaker, this is Delegate Thomas Walker. I'd like to request for an item, a report item, to be added on the agenda. This would be a report from the HESI Committee on legislation 0074-20, which is the also known as the school board apportionment plan. They acted on that yesterday, and I would request that they provide report to the Nabi committee today on the plan, so that all council members are apprised of the impact what that legislation is on Navajo. It affects all 110 chapters. Sir, I make that request or motion to add.
Yeah.
Okay, Vice Chair Walker, can I make a suggestion to add on as well a report from on NCI, and then also a report from Dotech. Those are the two that want to be added on as well.
Okay,
That's okay.
certainly.
Speaker, this is Delegate So.
Chairman So. Hold on, Chairman So. Let me get a second. Is there a second to add those three on? Motion by Honorable Thomas Walker. Is there a second?
Freeland will second.
Honorable Freeland. That. Honorable Daniel So. Chairman So. Chairman Daniel So.
Speaker,
The motion by Walker, second by Honorable Freeland.
Speaker, this is Helena. I'd like to add.
Chairman Daniel So. Honorable Helena.
Yes, sir. I'd like to add on also a report from Wayne Claw about to report on Chinley Nursing Home and Annie Juanita Care Center.
Okay, with that, Honorable Thomas Walker, are you good with that?
Yes. Yes.
Okay, Chinley Nursing Home. Honorable Freeland, you okay? Good?
Yes, sir.
All right. That back to Chairman Daniel So.
Their phone went out over there, but you.
Is I think Chairman So's in the Budget and Finance Committee conference room. That phone went down. BNF, the phone went down. So that's report by NCI, then Dotech, then 0074-20, the appropriation plan that was passed yesterday by HESI. And then last but not least, the Chinley update from on the Chinley and Eniwanika nursing homes. Honorable Helena, do you have individuals that are ready to talk on that? Those two subjects.
Yes, we got Wayne Claw standing by.
Okay.
Yes, I'm here. Speaker, this is Bill.
I can hear somebody say speaker.
Yeah, this is Daniel So.
Chairman So. Chairman So. Chairman So. Chairman So.
Yes, Speaker, I'd like to request Honorable Walker and Freeland to add 0039, 0048, and 0088, all -20 to the event.
I have 88. I couldn't get those first two, Chairman. So what was the first two?
39 and 48
39 and 48
and 88.
and 88. 39, 48, and 88. Let me go to Mr. Botero first before I ask Mr. Walker for that. Mr. Botero, can you explain what those three legislations are?
Mr. Speaker, all three legislations were emailed to the delegates yesterday. Legislation 0038-20, an action relating to the Resources and Development, Budget and Finance and Naabik'iyati Committee and the Navajo Nation Council, allocating $1 million to the Navajo Tribal Utility Authority from the Citizen Fund to assist in funding materials to connect Navajo homes to the electric grid under Light Up Navajo 2, approving and adopting into a material fund expenditure plan pursuant to 12 NNC sections 2501 through 2508, legislation 0048-20, an action relating to resources and development, budget and finance and Naabik'iyati committees and Navajo Nation Council, approving supplemental funding from the unreserved undesignated fund balance in the amount of $2 million for the Navajo Nation's Department of Justice Water Rights Litigation Unit to continue litigating on behalf of the Navajo Nation and to protect the Navajo Nation's water rights, waiving 12 NNC sections 820E and F. Legislation 0088-20, an action relating to health, education, human services, Naabik'iyati, and Navajo Nation Council, confirming the appointment of Ronald Milton Thompson as Superintendent of Schools, Navajo Department of Diné Education. Mr. Speaker.
With that, Vice Chair Walker, you good to modify your motion?
Yes, I am. This is Thomas Walker.
Yes. I'm feeling you good?
Sir, I'm good, thank you.
Okay, 39, 48, and 88. Hey, that, any other comments, questions, colleagues, on the agenda? If not, we can go to the second reading.
Speaker, this is Delegate Clinton.
Madam Chair Connie.
Lots of echo. I apologize. I just need to know if those reports were motioned to be added to the agenda or an update.
You mean the two that you recommended, NCI and Dotech?
Yes, sir.
Yes, those two are the first on the agenda to go. Okay, anybody else? Comments, questions? None? Once? Twice? Someone said speaker. We got a second reading.
Mr. Speaker, the proposed amendment to adopting the agenda is a motion to add report from Health, Education, Human Services Committee on Legislation 0074-20 and the impact on the Navajo Nation and Navajo Nation chapters. Also, a report from NCI and Dotech. Add report from Wayne Claw to report on Chinle Nursing Home and Annie Winiko Nursing Home. That will be report D at legislation 0039-20, 0048-20, and 088-20 to the agenda. And also, there was a request to delete legislation 270 from the agenda, but it hasn't been added yet.
Which one's priority? So Elmo.
Delete 270.
So Elmo something. So the kids gonna be delivering. Just
Honorable
Can we
Albert Gay.
delete legislation 270? Elmer Gay concurs.
Okay. Honorable Walker, you good with that?
oh yes.
Hey, with that, Honorable Freeland, you good?
I'm good with it. Thank you.
Hey, with that, roll call, go to board on the agenda.
Elmer Gay.
Vote green.
Key Allen Gay.
Delegate Calvin McGay votes green.
Paul Gay.
Delegate Paul McGay votes green.
Nathaniel Brown.
Delegate Advocate. I wonder how to play now.
Did he vote? Nathaniel Brown.
Delegate Nathaniel Brown votes green. Can you confirm that you're getting our votes?
Eugenia Charles Newton.
I vote green, and please, yes, confirm that you got our votes.
Confirm. Amber Crotty.
Delegate Amber Tanas-Vaucrotty votes green. Thank you.
Amber Crotty votes green. Herman Daniel.
This is Delegate Herman M. Daniels Jr. I vote green.
Honorable Herman Daniel votes green. Mark Freeland.
Pay attention. Oh.
Is he there? Pernell Halona. Jamie Henyo.
Jamie Henia votes green.
Honorable Jamie Henyo votes green. Vince James.
Delegate Vince James votes green.
Honorable Vince James votes green. Ricky Nez.
Delegate Rick Nez votes green.
Honorable Rick Nez votes green.
Sorry, I accidentally hung
Slater.
up.
Delegate Slater votes green.
Honorable Carl Slater votes green. Raymond Smith.
Green.
Honorable Raymond Smith votes green. Wilson Stewart.
Stewart votes green along with Freeland. He's back online.
Sorry, we hung up.
Honorable Mark Freeland. Honorable Wilson Stewart votes green. Charlene So. Daniel So.
Daniel So votes green.
Honorable Daniel So votes green. Eugene So.
So votes green.
Honorable Eugene So votes green. Otto So.
Otto So votes green.
Honorable Otto So votes green. Thomas Walker.
Thomas Walker votes green.
Honorable Thomas Walker votes green. Edison Winika.
Green.
Honorable Edison Winika votes green. Edmund Yazzie. Jimmy Yellowhair.
Delegate Yellowhair votes green.
Honorable Jimmy Yellowhair votes green. Twenty in favor and 0 nays.
Hey, with that, colleagues, 20 in favor, 0 opposed, speaker not voting. Motion carries. We do have an agenda before us. That, moving on down, reviewing and adopt the journals. There are none at this time. Oh, that was amendment. Oh, that was an amendment. All right, jumping ahead of ourselves. Sorry, colleagues. That, back to the main motion. Any other comments, suggestions, additions, deletions to the agenda? Going once, going twice, going 3 times. Back to the roll call. Oh,
Elmer Begay.
actually, before we do that, let me go to a second reading. Sorry, Bobby.
Mr. Speaker, members of the committee, there's one approved amendment, motion to add report from Health, Education, Human Services Committee on legislation 0074-20 and the impact on the Navajo Nation and Navajo Nation chapters, report C. Also report from NCI, report A, and Dotech, report B. Add report from Wayne Claw to report on Chinle Nursing Home and Annie Winika Nursing Home, report D. Add legislation 0039-20, 0048-20, and 0088-20 to the agenda. Delete legislation 0270-19 from the agenda. Mr. Speaker.
That, we go to the board. Bobby, go ahead, roll call.
Elmer Begay.
Green. This is Delegate Begay. Green.
Honorable Elmer Begay votes green. K. Allen Begay.
Delegate K. Allen Begay Jr. votes green.
Honorable K. Allen Begay Jr. votes green. Paul Begay.
Delegate Paul Begay votes green.
Honorable Paul Begay votes green. Nathaniel Brown.
Delegate Nathaniel Brown votes green.
Honorable Nathaniel Brown votes green. Eugenia Charles Newton.
Honorable Delegate Charles Newton votes green.
Honorable Eugenia Charles Newton votes green. Amber Crotty. Herman Daniels.
Delegate Herman M. Daniels Jr. votes green.
Honorable Herman M. Daniels votes green. Mark Freeland.
Let me try not to push the wrong button this time. I vote green, Mark Freeland. Thank you.
Honorable Mark Freeland votes green. Paul Pernell Halona.
Halona votes green.
Honorable Pernell Halona votes green. Jamie Henio.
Jamie Henio votes green.
Honorable Jamie Henio votes green. Vince James.
Delegate Vince James votes green.
Honorable Vince James votes green. Rick Nez.
Delegate Rick Nez votes green.
Honorable Rick Nez votes green. Carl Slater.
Delegate Slater, green.
Raymond Smith. Honorable Carl Slater votes green. Raymond Smith.
Green.
Honorable Raymond Smith votes green. Wilson Stewart.
Stewart votes green.
Honorable Wilson Stewart votes green. Charlene So. Daniel So.
Daniel So votes green.
Honorable Daniel So votes green. Eugene So.
Votes green. So.
Honorable Eugene So votes green. Oto So.
I vote green.
Honorable Oto So votes green. Thomas Walker.
Thomas Walker votes green.
Honorable Thomas Walker votes green. Edison Winika.
Green.
Green.
Honorable Edison Winika votes green. Edmund Yazzie. Jimmy Yellowhair.
Delegate Yellowhair votes green.
Honorable Jimmy Yellowhair votes green. 20-0. 20 yeas, 0 opposed.
Hey, that, any favors or opposed, speaker not voting, chair not voting. We do have an agenda before us. Thank you, colleagues. One amendment. Let me go down to reviewing adopted journals. There are none at this time. Receiving reports, there are none. Staff, actually there's four, four reports, but can we get a, updated, updated agenda and send that out? Receiving report, item number 1, report and update from, on Gallup's NCI office and services that they're offering. I know that we have Ms. Rosalind So on the line. Maybe I can just turn it over to you, Ms. So.
Thank you. Good morning, everyone. I appreciate the time to give you an update. So most of my time over the past couple of weeks have been spending a lot of time on the NCI situation. I think that most of you hopefully are aware of the situation. NCI is a detox facility that is in the Gallup area and has been there for a while. More recently, if any of you know, IHS does put a little bit over $1 million into this contract for this program because we know that many of our Navajo or American Indian use this facility for detox. So as you can imagine, during this pandemic that we're dealing with, we are also talking about a fairly high risk, normally probably already high risk, but even more so during the situation that we're in. So around about April 8th was when we identified our first case, and we believe that there was positive cases before this time, probably as early as the 30th of March, and then a few days after that. So at this point, at a very high level, what we're trying to coordinate is that we have done some tracing, and remember the tracing is just going back to see who was positive and if who that person might have had contact with. And then so we start to go back and advise them that maybe you were exposed or you should be careful or go self-quarantine and whatever. And as you can imagine, this group is probably not the most obedient group to try to do self-care anyway. But so we were able to track about 170 individuals that would have had contact with the first positive cases that we saw. At this point, we have tested 81 of them, and 59 of them have come back positive. So again, a very high-risk population, and our percentage rate, you can do the calculations there that certainly more than 50% are coming back positive. The problem that we have is that there's at least 89 of those original 170 that we were tracking that we are unable to locate. So what this means for us is that, of course, we are not talking about QT spread. And so that means that these individuals could very well continue to walk around or travel around not only the Gallup area, but if any of these individuals live in the specific communities out in the on the reservation, and if they were just in town for the weekend or during this time period when they might have been exposed. Now we're trying to figure out how do we try to get information back to maybe their families or their children or mothers and fathers and so forth. So then again, community spread means that if a person's positive, they take it back to their home. That's where it's now moving to, again, very much is what we have seen throughout Navajo Nation. So we continue to work very closely. On the 10th of April, I had 2 briefings with the President's Office and the Navajo Nation Health Command and Department of Health to advise them of the situation. And at that time, what we were desperately trying to do was at least find some hotel space for these individuals. So we had to close down the NCI because, again, it is not suitable for what we are dealing with right now. You cannot just put everybody in one room and expect them to be okay and not add to the situation that we're in right now. So our office, Navajo area, myself is leading this for the Navajo area, while I have other people covering other things. We're working very close with Rehoboth, McKinley County, and the New Mexico Department of Health as well, because we know that we're just not talking about Navajos or American Indians or other groups that are needing care at this point. So we were able to secure Motel 6. We got 45 rooms. The Howard Johnson, we got 80 rooms. And then on Saturday, we were able to secure another 80 rooms. Again, the problem that we have is that if we are asking positive patients to self-isolate, again, they're not always obedient or following the guidance that we're providing them. So we're estimating at least 10% of these individuals are leaving the hotel during the day and continue to move around, and so therefore, again, possibly continue to do community spread. So we have done it as much as we continue to do what we can for this population, and we will continue to be a party to finding solutions for this unique and special group of people. What we're finding right now, though, because we have no option to sort of intoxicated person to a location like the detox facility, they're now coming into the emergency room. So they're overwhelming our emergency room system, both on the Rehoboth side and the Gallup side. And so what this does is that it doesn't allow us to sort of keep beds open for the COVID patients or the population that we've been sort of planning for. Nonetheless, it is our responsibility to continue to try to find and coordinate care as much as we can. So the hotels that we were able to secure, working with the New Mexico Department of Health, does provide a room for them. So we're sort of trying to isolate them to a room. It does include food, and so we're able to offer some guidance and some assistance. And how these individuals actually can get to a room is they either have to present at Rehoboth or at GIMC, and then a referral is issued to that hotel, so then they can go to the hotel. So what we're struggling with right now, of course, is just trying to contain and keep these individuals in place for at least the 14-day quarantine period, and then and then hopefully then we will move beyond this particular situation. So where we are at right now today, I have a call at 1:00 with a number of stakeholders. I just cannot say enough about the IHS people. I have two doctors that are almost working around the clock to really help coordinate and guide me through this process in terms of it, and also providing a lot of technical assistance to the mayor and other federal government officials at the city and state level. I suspect that this issue will continue to get publicity, and I want to make sure that there's proper messaging around this, and not just stereotyping that may come out of this. So, we need some help there in terms of how we can message the issue that we're dealing with. So, when I was on the call yesterday, the mayor did say that there was limited communication with the Navajo Nation or the command center. So I don't know how we can work through that part of it. But we are now is that we have secured and we're trying to clear out and make I guess there's a juvenile detention home that has about, or the facility that has about 30 rooms, and so we can sort of isolate these individuals from each other, so they're not all congregating and being around each other. So we're quickly trying to do that. I did also hear that either the state or the city was going to be calling out the National Guard to help with some of the, helping to keep the people in place and not let them continue to move around. Again, I'm hoping that there's a Navajo official voice that ensures that whoever comes in to help with this population, that we're treating our people and our patients respectfully, regardless of their situation. So that's another thing. So I'm hoping that one of the things that's very important right now is even if we can open up this detention home to try to isolate and contain, for lack of a better word, these patients. It needs to be done, carefully, and most of these patients, again, you can't just take them off of the dependence of alcohol because of the other factors that come into play, and then they'll be back in our emergency room as a result of that. So it's a very carefully coordinated situation that needs to happen. We also, as the federal government and the Indian Health Service, we're trying to research what abilities do we have to sort of force people to stay in place, and there's very limited. We're a healthcare system. We're not the judicial system in terms of trying to coordinate this part. So there's a lot of things that are moving right now that we're trying to do, and my hope is that again we continue to wrap our arms around all of these people that we're talking about, particularly our Navajo patients or American Indian patients that might need this service. And we're also looking for staffing, and I believe that that's what the call for is at 1:00. So I can speak on the IHS healthcare side, but I don't know if there's a whole list of people that's invited to that 1:00 call, but I don't know who actually can speak for the Navajo Nation part of it. So that's something that I'm hoping maybe this group can have someone identified to help me be on that call, because I have certain lines that I can't cross either. So I'm going to stop right there. Again, a tremendous amount of work, a tremendous amount of coordination that is happening here that I think is really helpful. One of the things that I heard on the agency calls that we're on is that if we can create at least some kind of a model or a framework, maybe we can move this type of framework, that all the coordination efforts and the communication, who needs to be involved, and what issues should be considered, because I know that the same sort of border town issue is at Shiprock, Page, Flagstaff, and maybe other places too, that we really need to be involved in this, we meaning the Navajo Nation, and I realize I'm the part of the government, but the nation really needs to have a voice to make sure that we are doing the best that we can for our people, for our patients that we're trying to treat, regardless of what their issues are. So I'll pause there and address any questions if you have any. Thank you.
Speaker, this is Delegate Charles
Thank
Newton.
you, Ms. So, for that update. Before I go to my colleagues, is there anybody from NCI that's on the phone? On the call?
Mr. Speaker, I did try to get a hold of Dr. Foley, and I did not hear back from him yet. So I know he's on the call at 1:00, but I did try to leave a message for him.
Okay, we did try to reach out to him too, but we didn't get anything back. So I don't know if there's no one else, I can return it back over to my colleagues. Colleagues, if you want to speak, remember there's the line to text into, and there's that line, that number was sent out again. But I do believe the only one that has spoken right now is Madam Chair Charles Newton. And then Honorable Keon Begay after that.
Speaker, first, if you could tell us what that number is again, because I was looking back. The only number that I have is the number that Julissa was on the last time, So if you could just send that out before the next speaker. Thank you so much for the update, Ms. O. So of the 89 that are currently out there, can you tell us which states they're from? How many are from New Mexico? How many are from Arizona? How many of the 89 are Navajo? And at this point, what are you doing to try to get these individuals back in to get tested? And then last, what can we do to assist you during this time? I know that yesterday in our call, we did talk about, some options. And one of the options that I presented was to work with elected officials from the chapter to try to get information out to them and to let them know that these people are currently, they need to come in and get tested because our elected officials know who are within their communities, and many of us know the relatives who are out on the street. Either we see them or we know them by name. So that was my suggestion. The other suggestion is to possibly go on to KTNN and KNDN and just read their names and ask them to call you. That way you're not sending a community panic and saying that, giving any more information than you had to, aside from to have them call your number. So those are my questions and my suggestions. Speaker, I'm going back on mute. Thank you.
Colleagues, the number was sent out again from the legislative email, and then I also just now sent it out from my email address. The number is 505-422-3203. Again, the number is 505-422-3203. That, we move on down. Honorable Keelan McGee.
Good morning, Speaker Do, Adam, so appreciate the report. I sent in the Form 213 on April 5th or April 8th, which is last Wednesday. I don't know why we have to send these in with no response, right? With the turnaround of no response, because I just need to disseminate accurate information to the local community. There's a lot of Jeanette going around, and I don't know. I mean, I don't know if there's too many people do the briefing or making reports to the chapter. In a way, is somewhat confusing to the local community. We got an email this morning. The increase of number in our area, Chinle Agency. I think Delegate Slater, Delegate Yellow Hair, and Delegate Eugene Stowe are on the line. I don't know if it's necessary for us to have a separate meeting to talk about it, or you could address that with this particular call today. I mean, I don't feel comfortable just having a report only to the Chinle Agency, but more with the whole council, because eventually we're going to turn around and talk with the full council again. So I think it would be more appropriate if we could just be able to discuss that particular purpose that you were asking for the meeting to talk with the Chinle Agency delegate. But I appreciate everyone, especially the doctors and nurses and first responders, doing their best to. And again, the other thing too is that they're beginning to getting tested positive. So so specifically for the Chinle area. On the I-213 form, I request for updated information regarding the Chinle facility, the Pinion facility, and the Saley Clinic. Thank you, Speaker.
Hey, that, moving on down. Honorable Paul Begay. Honorable Paul Begay. Honorable Paul Begay, going 3 times. We move on down to Honorable Wilson Stewart.
Thank you, Speaker. Ms. So, this is in regards to what you just stated, what you just reported, rather, and that yesterday I did receive a phone call from a community member out on the Eastern Agency side. And the phone call was in regards to their relatives that live with the grandmother. And these relatives, they are alcoholics. They come and go from the home. The virus, grandma, as of yesterday, the grandma, she ended up going to San Juan. And prior to that, I guess they had called to request that the ambulance from Crown Point come out to grandma's residence and pick her up because she was very ill. And Crown Point went and told her, no, we can't go out there. We're not able to go out there to pick her up. They didn't know what to do or where to go. They were calling around to different people. They ended up calling Gallup. And then also Gallup GIMC, they sent the ambulance out there to where grandma lives, which is almost in Crown Point, between Crown Point and Borrego Pass area. And then they took her in for testing, and then they went and did what they needed to do. And so they just ended up transferring her to San Juan Regional. They went out. They went and got other relatives tested. There's like 6 homes in this area where grandma lives. They went and got tested. So that's one thing I wanted to bring in. I guess these individuals, the Quishing, I don't know if it's 2 or 3, maybe 1, but I guess they keep telling that individual, go get tested. And that so I told the person that contacted me, I said, contact the command center. They'll probably tell you to fill out the 213, fill that out. And then also, if you can, I said, submit a description of that individual to them. Because it's getting to that, I believe it's getting to that point now where you stated you don't know what to do with those individuals. You don't know what to say or where to take them. That's one area of things that we are needing to contact as well.
Honorable Stewart, hold on. Colleagues, can you please put your phones on mute? When it's outside in the wind getting blown around. Thank you very much. Colleagues, just remember to keep your phones on mute. Honorable Stewart, let me go back to you. Honorable Stewart. Maybe nothing. Let me go back to, or let me go down the line. Honorable Freeland. Honorable Freeland.
Yes. We accidentally got hung up.
Okay, well, is Honorable Stewart still there with you?
Yeah.
Hey, Honorable Stewart, you want to finish?
He's the one that hung up on us. I'll think I was done.
Okay. Go ahead, Honorable Freeland.
Thank you, Speaker. Members of the Naabik'iyati Committee, Chairman Damon, as well as all my colleagues. I really wanted to ask Ms. So how you have been, or if you have been coordinating with the Navajo Nation's Incident Command or Health Emergency Command Center, and what has been their response to this matter, if anything. I ask this question because, I don't think this is a time for us to distinguish if this is a Gallup problem or another problem. This is actually our problem as well, as a whole, and we shouldn't be pointing fingers back and forth. We just got to put all the differences aside during this time right now and help our relatives and those who are out there right now in Gallup or wherever they may be. God forbid, those who have come back and affected elders or children or others, that's a very serious matter. And I can honestly say I lost sleep over this matter, and it's heartbreaking, and it really, really troubles me a lot, my colleagues, to think of.
Speaker. Speaker, can I ask a question?
Well, anybody else? Oh, who is this? Elmer Begay?
Delegate Elmer Begay.
Go ahead.
Okay, no. Thank you, Speaker. Since we're talking about people that are out there, I know that it's hard to have a person living, and maybe you try to help them out with to be an alcoholic. That I know that we lost some relatives. That we did what we can, but we didn't succeed. I guess I would say that, but I want to know that where the Navajo Nation Department of Behavioral Health stands on this, and they have another regional behavioral health that helps these kind of people. I wonder if they're on the line listening, and what is their procedures, or how can they help? I know that right now they're probably out there. I don't know if they're the essential employees, and they should offer some type of assistance for these people that are from the reservation. So I just want to know how are they helping out, or what are they doing? That's my question. Thank you.
All right. I don't have anybody else. Let me go back to Ms. So. I think there's some questions that we're trying to figure out. Especially a question that you had about who's the individual that you're working with at the nation. We're getting that information, Ms. So.
So I'll go back to the first question with regards to the data. Yes, I am working as hard as we can to try to identify. Remember, not all of these individuals that we're talking about have sort of an address that we could tie them directly to, but we are searching to make sure. And that was the task that I took on yesterday, to work directly with Dr. Foley as well as the IHS people to see if we can determine where these individuals are. Again, we're talking, 89 sounds like a small number in terms of it, but it's not. It is so crucial right now to find these 89 individuals. Plus, between the day that we started collecting all of this information to now, we have no idea. I mean, the magnitude of this situation has just will just explode, and it is exploding right now. So I will try to get that information by state, and I'm going to push everything that I can to try to find a way to, even if I have to sit down with local tribal people to say, do you know this person? Do you know this name of this individual? So we can at least do our own community tracking of what we might do. You know, in a different setting, maybe we're able to do this. Again, I was on the phone with John Hopkins yesterday to say, I need something now that helps me speed this up a little bit. And, you know, I realize the HIPAA rules. I understand that. I'm respectful of that. But we're also in a pandemic situation too, and I need some opportunity to do that. So I took that on, and I will hopefully have a report within the next day or so, exactly on the data part, and then try to figure out a way to do that. I cannot give individual names, but maybe I can sit side by side with someone that says, yeah, I know who that person is. That person's from this area or whatever. And what I'm trying to do at this point, and what I want just to be able to do is at least, let's say for as an example, maybe that person went back to Tohatchee. Maybe that's where they're originally from. I want to reach out to Tohatchee and say, okay, CHR or someone, notify this family that this person might have been in this area during this time. That's what we have to be doing right now. And every minute that's going by to not be able to do this is causing community spread. So I am committed to following up on this data, and I will share that. And going back to Mr. Key Allenbigay's question about coordination, I did reach out this morning to the Speaker's office, and I asked for a meeting just, again, with the Chinle area delegates. And my reason for that is I think that we've had some very positive meetings with the Eastern delegates. And my goal there is to provide them more information than I probably would publicly, but more information specific to their area. And that's how we were able to have, I think, great conversations about NCI that helps me better understand, but also to make sure that the delegates in these particular areas are aware of the specific issues in their area. So I don't know how else to better do that. I'm willing to coordinate and do whatever we need to do, but that's the reason for that. And so I'm still very concerned that we have hot zones in the Chinle circle. And so that was my reason for reaching out, to make sure that, again, the delegates are being kept informed. These are your communities. What can we do? What's missing? What else have we done? And so what I like to do is take best practices from what we're already doing in other places, like the situation with NCI, and I want to send that over to the Page area or to the Flagstaff area and say, hey, this is what we did. This is how we did it. Maybe a model to replicate. So that's my only reason for that. I can certainly report to whoever you want me to report to, and I have no problem with that, whether it be this body or what I was looking at. And I think that Chairman So and Delegate Yazzie and Delegate Freeland were on a call with me the other day that I thought was a very helpful call in terms of sharing of information. With regards to Mr. Stewart, your questions, I take that to heart. I think every situation that I'm dealing with these days are, I'm just taking on all of these situations that we're dealing with. I will pass my cell number to the Speaker's office, and you can share my cell number with this group, with the delegates, because if you are hearing about a situation that involves, like the comment that was made earlier about Crown Point, I have responsibility over Crown Point, I have responsibility over Shiprock, I have responsibility over GIMC, I have responsibility over Chinle, and I have responsibility over Kayenta. You hold me accountable for those things. So if you're hearing these kinds of things, I want to know about them so we can get in front of them and address them immediately. This is no time to say this or that or whatever, but those facilities are under my direct responsibility. So I'm glad I'll share my, again, contact information, text me, call me, whatever it is that you need. With regards to Delegate Freeland's comment about the command center, as I shared earlier, on the 10th of April, I did brief the president and a smaller group, and then there was another call later that day where I briefed a bigger group, and I know that the command center people were on there, Department of Health was on there, I think Behavioral Health was on there, and I can't recall if EPI was on there. I don't really know what to say about that, and I'll just leave it at that. Other than I was informed that there are jurisdictional issues and whatever. So I'm beyond that point at this point right now. I'm going to continue to be active in this area. As I said, a call this afternoon with the mayor's office. I have to focus on not only the safety of my staff is absolutely paramount right now, and to ensure that we're not doing things that are going to put my staff at risk. But we are talking about a very high-risk population here that does pose a risk to all of us, regardless of our situation. That's just where we're at right now. So I'm beyond the part. I just have to try to figure out a solution, and whatever I need to do to continue to communicate. What my role is going to be is to communicate the facts as I know it within the Indian Health Service, and to try to sit at the table and coordinate with the city and the state and whoever else I need to be doing that with. And the last comment from Mr. Elmer Begay. And it is my understanding, I'm not sure, I'm using all of the federal staff at this point, and they are doing a wonderful job in trying to address this particular situation, at least as it relates to the NCI, GIMC situation. Thank you.
It's on the diary, but he doesn't want to fall. He's secure. That's not how you use the extension.
Okay, thank you. Let me go back to the panel, or back to the board, back to the floor. Chairman So.
Thank you, Speaker Damon, and Naabik'iyati committee members, colleagues. Basically, I really want to commend Area Director Rosalind So for not waiting. I'm aware that she's filed Form 213 to request PPEs, and they're being trickled to the HS. And for me, there's the great big appearance that the Health Command Center is just a bottleneck in the effort to get the proper health care, to get the proper health response to our people. For my view, the Indian Health Service has a responsibility, not only a trust responsibility in the provision of health care, not only to the President and to the Council, but to their every single member of the Navajo Nation who has a census number. In this respect, that's how I view those.
Colleagues, has a phone.
Delegate, can you mute your phone?
Mute your phones.
Maybe the signal was I was providing too much static. That's just to put a smile on everybody's face. But the main thing is the fact that Ms. So has taken this almost on a personal issue. I really feel like the council really needs to give her the undivided, uncompromising support to go do what she has to do to take care of the patients. I really feel that that's what we need to do. And again, like I said, I want to reiterate that the Health Command Center is just now another form of bureaucracy with the intent and purposes of getting reimbursed by the Federal Emergency Management Administration, and not in the way of trying to prevent the spread of the coronavirus. The coronavirus is the culprit. The Kosinsaigi, Katninigi, that's a result. And that's the message that ought to be taken forward. But in this respect of the NCI, yes, it is every one of us have family members that are afflicted with this multifaceted chemical addiction. And so we can't just look the other way. We have to help as best way as we can. And I'm sure what Brother Cecilia Wilson Stewart talked about is the reason that they're also, these families are reaching out to whoever is available, because the chapter houses are shut down. And so at that point, they're just, they just probably by personal reference, they reached out to Honorable Wilson Stewart. The other aspect is just the fact that I'm worried that NCI, the actual facility, shut down, and everybody has to then go to get the hotels to basically be the places where the self-isolation, the quarantine would be taking place. And we all know that that the effect and the purpose of getting the hotels it doesn't serve what really needs to happen, and it's that quarantine. So committee members, the other part is Ms. So had provided a one-time screenshot of data where she provided, in each service unit, the number of positives. And then also she provided by 10-year age groups, all the way from infants all the way to the 80 age group. And on that particular day, there was 7 positives on infants. And so that really drives it home that it's not just the elder. It's not just one person. There is multi-generational inhabitants of the homes, and that's where the community spread is happening, and the numbers keep increasing. So the committee members, I'd like to request officially that Ms. So provide us those data by age group, by service unit, by gender. And at the same time, I'd like to also request of the committee to allow that data to be shared with the UNM Health Services Department. We already have a working relationship with Middles Research Group headed by Dr. Johnny Lewis and Dr. Shuey, where they can provide us a good analysis of exactly the forecast on how this thing is spread. And with that, Mr. Speaker, I'd like to make the motion to accept the report and then also ask the committee to request that data as I outlined to be able to refer that data to the UNM Metals Research Group committee members. Mr. Chair, thank you.
Okay. Let me go back to before. Um, I- am I on? Yeah. All right. Let me go back to Ms. So. Honorable Chairman So. Maybe she can give us some insight on that direction, and then we can go ahead and follow up after that to see where we can go ahead and do a follow up report on that. Ms. So.
Thank you, Speaker Damon. So again, this is Rosalind. So we do have a fair amount of data that Chairman So is referencing, and the data that we are tracking, and we have a lot, I think, of very, very good data. These are regarding the work at our IHS facilities. So the numbers that you see, the reason why there'll be a difference, and I want to be clear on this, is that I'm more than happy if you can tell me to give you the data. I will do that. It'd probably be easier for me personally if you can direct me to do it, and I'm glad to do that. I can give you the data on the work that we're doing at the IHS facilities, and the reason this is so important is because you can see on a daily level what our daily census is in a hospital. So if we, and this is why we can talk about NCI and that our ER rooms are overwhelmed, is because we track this. We know how many beds we have available or don't have available, and that means that we have to either move patients out to a higher level of care and so forth. So that's how we use the data. But with regards to what we have heard, I think in the general public, where this is just affecting the elders and this is affecting population, you'll be surprised that there's a lot of our cases that are in that middle age group, probably between 25 and 40. That we are starting to see some of those numbers in the national level, but it's just crucial. There's nobody that's going to be eliminated or not included as the way this virus is working through the process. So I am glad to give you the reports that you are asking for, but just keep in mind these are only reports of the federally operated program. What you see in the press conferences from the Navajo Nation, that is all of the 638 program. That includes all of the healthcare centers on the Navajo reservation. So. But I think that for our purposes and the reason that we can plan and adjust as we have been doing is because we have good information that allows us to do this, and I rely on that on a daily basis to see and scan our organization. In addition to that, is we do have PPE burn rates that are tied to each facility, so I know how much are we burning through, and you can imagine that in the GIMC area and the Chinle area. They're burning through a lot of PPE because of the activity that's going on there. So I need to adjust to make sure that they have sufficient PPEs as we move forward. So all of this information is very valuable. I think that as we move forward, it is absolutely important that we do have some, what Chairman So is talking about, whether it's Johns Hopkins or UNM or whoever, because these individuals that we're finding are going to have other health problems as a result of this. Their lungs are never going to be the same. And so what do we do there? That requires now another level of follow-up and care that our patients are going to need at all ages now that maybe would not have had that if we didn't have COVID. So there's many things that we use that data to help drive what kind of system do we need to help us address this when we come out of this, and we will come out of this. But we need to, I like to look forward and be a little bit more strategic in the way I approach things. So having this data is crucial. You having the data up for your specific communities is very important because you know your communities better than I do. Thank you.
Okay, thank you. With that, Honorable Chairman, so what we'll do is, with your motion and accepting this, because I know that Ms. Rosalind So has to go and to another conference call that she has in another 5 minutes. I can accept your motion, and with that request, Ms. So, you'll be hearing from us, and we'll go ahead and formally request from the Speaker's office that information, and then once we get that information, we'll dispense that back to my colleagues on the 24th Navajo Nation Council. So I can recognize that motion at this time.
Mr. Speaker.
Delegate Halona.
Is there?
Delegate Halona seconds that motion.
All right. Hold on a second. Chairman So.
Yes, based on the response from Ms. So, I'd like to also include the 638 authorized tribal health care facilities like Tehoto Medical Center, the Winslow Indian Healthcare Corporation, the Tuba City Regional Healthcare Corporation, as well as the Utah Navajo Healthcare Corporations. They do, they're authorized by the Navajo Nation Council to provide healthcare services. So I think a request for them to provide that same array of data rests with this committee. So that's how come I would add those organizations to my motion.
Honorable Maloney, you good with that?
Sir.
Yes, I'm good with that. Thank you, sir.
Okay. We'll reach out and then we can go ahead. Our colleagues, I'll have staff reach out to Ms. So's office, and then we'll go ahead and get the accurate request together, and then that formal request will be coming from the Speaker's office, Ms. So, and then also we'll be sending that request over to the 638 hospitals too as well.
Speaker, can I just say something real quick regarding Che's motion?
Honorable Freeland.
Thank you, Che. Thank you, Speaker. I'm sorry. Che, could we also include Tohajale, Rama, and Alamo? Alamo's seen a big spike as well. They're also, I believe, under the Albuquerque area, if I'm not correct, Ms. So. But if we include the 3 satellite communities in your motion, Che. Thank you.
Oh, this computer? Okay. Chairman So, you good with that?
I will include Honorable Che Freeland's request into my motion. Thank you.
All right. Honorable Halona, you good with that?
Honorable Halona accepts that.
All right.
Inclusion.
Speaker, this is Vice Chair Smith.
Okay, well, before I go on to Vice Chair Smith, thank you very much, Ms. Rosalind So, for calling in. I know that you have another call here in 2 minutes, so thank you very much for calling in.
Mr. Speaker, can I make one more comment?
Yes, Ms. So.
As I said earlier, I have a 1 o'clock call with the governor, the mayor's office. Is it possible to have someone identified from this group that can be on that call with me? We don't need to decide that right now, but if you can give me someone, I can pass the phone number on to them.
Okay, Ms. So, we'll be reaching out to you. The individual from the Speaker's office that's been working on that is Ms. Sherilyn Yazi. And the other one that we know that the command center who's been looking into this is Ms. Ramona Antonez. So we can go ahead and get that information. I know Chief of Staff will be texting you that information and giving you Ms. Sherilyn Yazzi's information, Ms. So.
Oh, okay, thank you.
Okay. With that, Honorable Vice Chair Smith.
Well, thank you, Chairman, and also Naabik'iyati committee members. Good afternoon or good morning. This request is to the motioning party, my brother, and also second party, Halona. I'd like to include Edzil as part of that on the directive. I just want to thank you.
I think Nahadzil is part of Sayetso Medical Center, isn't it?
Yes.
So that was already included, Honorable Vice Chair Smith.
Okay, thank you.
Okay. All right. There's nobody else, colleagues. We do have a motion second to accept Ms. So's report on NCI. Again, colleagues, we are putting together a call tomorrow morning at 8:30 regarding NCI as a more formal update from the director, from individuals from the city of Gallup, individuals from the Navajo Nation Department of Social Services, and Department of Health will be on that call as well. So there's no other questions or comments. We can go ahead and accept the report. Go ahead, Bobby. Roll call.
Almer Begay. Almer Begay votes green. T. Allen Begay.
Delegate Callum Gay Jr. votes green.
Delegate K. Allen Begay Jr. votes green. Paul Begay.
Delegate Paul Begay votes green.
Honorable Paul Begay votes green. Nathaniel Brown.
Delegate Brown votes green.
Honorable Nathaniel Brown votes green. Eugenia Charles Newton.
Delegate Charles Newton votes green.
Honorable Eugenia Charles Newton votes green. Amber Crotty.
Delegate Amber Canesbaugh Crotty votes green. Thank you.
Honorable Amber Canesbaugh Crotty votes green. Honorable Herman M. Daniels.
Council Delegate Herman M. Daniels Jr. votes green.
Honorable Herman M. Daniels Jr. votes green. Mark Freeland.
Delegate Mark Freeland votes green. Thank you.
Honorable Mark Freeland votes green. Pernell Halona.
Halona votes green.
Honorable Pernell Halona votes green. Jamie Hino. Vince James.
Delegate Ben votes green.
Honorable Vince James votes green. Rick Nez.
Delegate Rick Nez votes green.
Honorable Rick Nez votes green. Carl Slater.
Slater, green.
Honorable Carl Slater votes green. Raymond Smith.
Green.
Honorable Raymond Smith votes green. Wilson Stewart.
Stewart votes green.
Honorable Wilson Stewart votes green. Charlene So.
Delegate
Daniel
Charlene So votes green.
Honorable Charlene So votes green. Daniel So.
Daniel So votes green.
Honorable Daniel So votes green. Eugene So. Otto So.
Green.
Honorable Otto So votes green. Thomas Walker.
Thomas Walker votes green.
Honorable Thomas Walker votes green. Edison Wanika.
Green.
Honorable Edison Wanika votes green. Edmund Yazzie. Jimmy Yellowhair.
Delegate Yellowhair votes green.
Honorable Jimmy Yellowhair votes green. 20 in favor, 0 opposed.
Thank you, colleagues. 20 in favor, 0 opposed. Motion carries. Moving on down, report from Dotech. Is there anybody on from Dotech? Colleagues, we have been trying to get the division directors, contacting the chief of staff, Ms. Henderson. There's nobody on from Dotech. We will continue to try to get them on. But once, twice, anybody out there from Dotech? Okay. Moving on to report by Health, Education, Human Services Committee on Legislation 0074-20, School Board Apportionment and the Impact on the Navajo Nation and the Navajo Nation chapters. This was a request by Honorable Vice Chair Walker. I'll go ahead and move it over to Honorable Chairman So and the HESI Committee.
Thank you, Speaker Damon, Chair of the Naabik'iyati Committee, and Cecilia Thomas Walker. I appreciate the fact that this report was requested through the adoption of the NABI agenda. Basically, it's the committee on February 7th voted to put 6 plans out for public hearings. However, 2 other sub-plans were made. So we have Plan 1, 2, 3, 4, 4A, 5, 5A, and Plan 6. And after public hearings were held, then the committee came back and basically wanted to just look at 4A and 6. 4A basically maintained the 63 school boards, but in the effect is the limit of the membership would only be 4 and 5, depending, the 5 being the upper limits for the schools who had enrollment of 300 or more. And then the Plan 6 basically then was to consolidate and come to, correct me if I'm wrong, consolidate to 16 school boards. And the 16 school boards basically then allowed, with amendments, allowed for Navajo Preparatory School to have 4 members at large from 4 of the agencies. The other that included that is Richfield Dormitory, which basically has 4 at-large members that are basically from the Western Agency. Others that were exempted from basic apportionment is Alamo was apportioned all 5 seats. To them, number one, because they have multiple 638 contracts, as well as Coahuila School Board, as well as Raymond Navajo. So those are the basic tenets of the apportionment plan that was adopted with a vote of 5 in favor, 0 opposed, the chair not voting. So that in a short capsule is what the HES committee approved. I would also call on Vice Chair Slater to fill in the gaps that I provided. I'm sure he has some further details on this particular report.
Good.
Good afternoon, colleagues. Thank you very much, Chair, for the presentation. I think it's important to note a few things in this process that I was driven by the statutes regarding apportionment that occur every 5 years. The consultation took place in a variety of forums, but the primary outreach included the 5 agency meetings. There was video recording of the presentations and the public comments, and there were transcribed notes on those comments that were distributed. So the committee voted unanimously to approve Plan 6, and that was based off a variety of factors. It is a substantial change from the status quo, but ultimately, in our investigation with the advisement of Dodie and our legal counsel, we believe we've made the best decision to help our schools fulfill their potential. And with almost every single school on the reservation, not within the BIE system, not meeting performance standards or being substantially below them, there does need to be some serious thought into how to pursue reform. And the committee at several different junctures, myself most vocally, asked for suggestions on how to change what it really is a broken system if it's producing the results that we're getting right now, time and time again. And there's a lot of factors, even just beyond educational results, the cost of special elections, appointment provisions, all of that. So in order to be innovative, advance our educational system, look towards a more integrated and developed and leveled up BIE system under the direction of Navajo, hopefully in the next 10 years. This, I think, is a necessary step. So thank you, Chair. Thank you, Chair Damon.
Okay. That, colleagues, any more information from the committee? Chairman So?
Yes, I'd call on the other members of the council, the HES committee, Honorable Wanika, Honorable Halona, and Honorable Begay, as well as Honorable So. And Mr. Chair, Philip, Mr. Damon, the particular HES resolution is in the hands of Mr. Rico, and with the attachment of Plan 6 and the maps that basically make up the apportion plan. That would be I don't have a copy of it right with me, so I'm depending on Mr. Rico to put it on the email system.
Honorable Chairman Stowe, Vice Chair Slater, and all the HESI members, plus the members of the council, Mr. Tom Potero, forward that resolution out at 11:51, about 15 minutes ago, and it's titled HESI AP-05-20. If there's no more comments or statements from HESI, then I can go ahead and get a motion. Their motion. Is there a motion? Going once. Twice.
Motion to accept the
Motion
report.
made by Delegate Charles Newton.
Motion made by Madam Chair Charles Newton. Is there a second?
Second,
Delegate
Helena.
James, second.
Honorable James.
Go for it.
That. Comments, questions, colleagues? Anybody? I don't have anybody on the board. I have nobody. Once. Twice. I don't have anybody that texted. Someone said speaker.
Speaker, this is Delegate Elmer Begay.
Elmer Begay.
I have a question.
No question?
I have a question.
Honorable Elmer Begay.
Okay, thank you, Speaker. I don't know thank you, Chair, Chair Wade, Daniel So, and then all the HESI committee. Thank you for your report. And out in the southwest reservoir where Dalcon, Tiso, in the Wells, White Cone, and Greasewood, we have some burns on the from the parents as well as from the school board members. I know that we're closer to the border towns, so we have some border towns like Winslow and Ethiopia, which is Holbrook Residential Hall, and they have some students that are in that residential hall. And then as well as Dalcon and Savidakai and Greasewood schools that are operated under grant. So a lot of times they went to this where they had that public hearing, and there were some questions that were asked and raised. So those particular questions pertaining to plans, how exactly it will change and to improve our school system. And we never got a response from the Department of the net education. So when can we get those response? These parents, they wanted to know how, and then also, as well as the school board members, that how they can get their answers. So this the main thing that from my area that they're still or looking forward for the answers. So if there can be any response, to share it, and then we could continue that. So I know that this is a big change that is going to be happening. But it's all in the best interest of the children. That's the way we look at it. That's the way I look at it. That there's, as far as the vision of the Department of the Net Education as well as the school board members, that we're there on behalf of the kids. So I think that the parents are more looking at how can our students, the kids that we have, how can we know that they're sure that the school system and then the reapportionment will help them to improve the school system. I think that's what the bottom line is. I know that this is just reapportionment. We could get regionalized, but that they're looking more at that how long is this going to take the process once it becomes a law? How is it going to start changing? When can we see that there's going to be changes in it? So that I think that's what the plan they wanted to see that. So maybe if it can be this kind of a plan should be available, then we could look at it. So, and then if it doesn't change by the date that they say that it's going to, if we can see it change, it's not happening. What are we going to do? Are we going to go the same trend again? I guess that's the question that we have right now. Especially we're in the midst of some very critical time right now to make this structuring this, changing this our education.
Hello?
IRS. I'd like to request for that. Thank you.
Hey, thank you, colleagues. Right now I have 49 people on the call, and it says 7 people don't have their phones on mute. So, colleagues, if you could please, everybody that's on the phone, if you're on a conference call, please make sure to mute your lines. With that, let me go back on down. We have 2 new players, Honorable Freeland, then Honorable Otto So.
Thank you, Speaker. My colleagues of the Naabik'iyati Committee. Speaker and my colleagues, I know this legislation was, I considered it highly controversial. There were a number of factors that were considered. Yes, the agency hearings were held, and speaking to my school boards, knowing that they had all agreed, and there was actually a resolution that came out of Crown Point that 4A was deemed the best plan by each agency. So was any consideration for resolutions made? Number 2, why was Navajo Prep and Ridgefield the only 2 schools that were made amendments to? Number 3, I don't think, in all due respect to Doty and what they're doing, when they say schools are failing, they also have to look at for potential reasonings. Number 1, the park test that they utilize at all of our BIE schools is very, very controversial. The state of New Mexico and I think Arizona recently did away with the park test. Partnership for Assessment of Readiness for College and Careers. That's why they're utilizing and saying that our schools are failing. Number 2, I feel that school boards are the ones that are not making the schools fail. It's really how our teachers are teaching the kids. So really looking at the quality of teachers as well as recruitment and retention. What is the plan for that, and how are we going to address that in the future? So really, that's really my reasoning. And I got a lot of phone calls last night. I was up late last night talking to my school board members who were asking why, what happened, and I'm having to bring this to the forefront and really knowing why this decision was made. And at least, if we could have had a further discussion as a whole and understanding maybe all delegates as your potential impacts to your legislative areas, get a more clear understanding And that's why, I'm saying that there's a lot of factors that need to be considered in this discussion. So with that, thank you, colleagues, and thank you, Mr. Chair.
Hey, thank you, Honorable Freeland. Moving on down, Honorable Otto So.
Thank you, Speaker. I too have some issues relating to this legislation that was passed. So we're talking about Western. You have a community such as Kabato, Tonlea, Gap, so basically, your school board is going to all be a big card. Ako the 20 heliti kehot, any don't like we told the kehot, any get. Your current member and you will only have one member representing your school to that agency school board. 20 today the 20 helito zizido e aja tanost ego aja ito asana tadole ako janas ego aja oltka na kisne to chot ehoto the nebenen ada honne dizige e ya sake e adetne e na kipabat nilo kolenal odo to kist eda aroti Washington ba oltkananas nilgi tonnes dizo tonne helne don da kabi tro a todne she askan na bekar ako jidi age ya dana Mr. So Matthew present ila I believe he's a school board member. I don't know if that raises some sort of conflict of interest, pushing the idea of ramrodding item 6 through the process. 4A, ashon, choho, ine, ashon, related the net, ashon, ban, case. Only they in the Aja Western no Henige Adet da Isno Age Nihol Khan but not so I can be card. Alcohol it the kai Chenli she so what not any neze da Isno I Hunanat Ado Abiyade Ashian ne hashin so the never tatato de the ne ado hajo bekek yada. I'm thinking that would be the first thing that you would look at. What does the Navajo people want? Not you as an elected official. Alcohol be nan go. The majority of the Navajo people supported 4A in those hearings. And again, with Department of with Doty, I have concerns regarding Doty. Ako aja hutata inishiki. Ako did the onash go. Oh, the never care for card. So I can the bad card. So I'm gonna go into Western. So you're gonna have 2 regions of school boards, 2 school boards, one for the BIE and one for the I guess for the Navajo controlled schools. Alcohol. It is the net on KDK population base, they're not in Coco. Do chot e do ben do bohne anda. Onsin. Alcohol. Azit asi akhadit ad khanat agoko. This is an issue relating to all the delegates across the Navajo Nation. Whether I'm not on HES or whether, but again, I do request that this legislation at least be brought to the Naabik'iyati committee for approval, because this is the same scenario I have like on Department of Transportation. You have 6 committee members making a decision on transportation issues relating to the whole Navajo Nation, but without no really consultation with the leadership. This is some that relates to all the council. To treat this as a controversial legislation. So, for instance, anybody from Kabato, your school board member is going to be all abolished, and you're only going to have one. Community of Tonalia, Tonahanle, Kehut, Iniki, Atkanabekado. You're going to share a representative according to what information I have. Safi Kin and Kabato chapter is going to share a representative. Alcohol benal go do hot eda. Alcohol ahot ego atso which is in iltela, and I would question our representative from Western. Or if you're in Chinle, you need to question your representative from Chinle. If you have a representative from Northern, you ask that Northern representative, Haishbenina. I represent a large community that has a large population base. Ebe nan go the neto be chot go enel ako be nash go do hot era ako hiran ako do ede do hot abe be nash ni the na anniki go da do I can send that. It makes me look that they're not about what the Navajo people say. To the whether you vote on it or but that's the only option. There's no other option. If That's enough term if by the House and Human Service Committee. That's another option. Any Navajo citizen out there can do that. Have the third branch government intervene. I go, what up, it is
Yeah, Chair of the Naabik'iyati Committee. Though colleagues, Mr. Slater, members report, providing the report to the Naabik'iyati Committee here. The information provided, that's appreciated. So just listening in again to the report, two plans that were mentioned, that were discussed in previous HESI meetings, and of course in the public forums also. Plan 4 or Plan 6. So those two were are, I guess, some of us observing this. It would be, those two will be decided at some point. But looking at it, there are two very different plans. They're like night and day. So what they call two very different plans, and that. So down to the wire, even the committee was refocused on Plan 4, 6. Very, very different plans. What the chair yesterday the plan and the meeting. They all something. They all either were in favor or not in favor, or they all had recommendations. But still, legislation was amended again. Then it's like, okay, that raises questions. So I too, like my colleagues, I represent an area that is served by 7 schools: Delcon, Holbrook, Flagstaff, Little Singer School, Gray Hills Academy, Winslow Residential Program, and of course Richfield. So the 5 chapters that I represent, children and grandchildren go to these schools or institutions. So my advocacy, even though this is Nabi meeting and we're only talking about this in the form of a report, Q&A, the advocacy must still be heard, must still be taken into consideration. Although, Mr. Speaker, I would ask for your guidance also in how to treat controversial legislations. If colleagues contacted you formally, telling you this is controversial. We wish alternatives, reconsideration, or more discussion, or of course work sessions. So we're not in a position to have full work sessions either. So I want to look to your guidance, and if legislative council also could provide some further guidance. So the report, I appreciate the report being given at this meeting. Okay, so the controversy will continue. Rather than having the controversy continue, and then having citizens or other leaders resort to legalities to address their concerns, rather than to resort to that. In the areas of legislations, what can we do there? With all due respect, there's a vote and issue. Mr. Speaker, I again request your guidance as to treating this controversial legislation, how to treat it from here on. If there's still concerns voiced by council members, give us some guidance here, along with legislative council. I would appreciate a response here. Thank you.
Thank you, Vice Chair Walker. Is anybody else? I don't have anybody else on my line. Let me go to. Let me go over to recommendations back to Health, Education, and Human Services Committee. If they want to respond, and then Speaker's Office with Office Legislative Council will respond to Vice Chair Walker's recommendation or request. Chairman So, Vice Chair Slater.
Thank you, Mr. Chair. Honorable Seth Damon, Otto, Naabik'iyati committee members. Yes, the Health, Education, and Human Services Committee views
there it goes. Thank you. Chairman So, go ahead.
Okay. Basically, the committee viewed it as a very controversial legislation. And for myself, I did try to get the committee to consider 4A, and that's even before. So that's how come the two alternatives were put beside each other, 4A and 6. However, yesterday the committee basically proceeded with Plan 6. In questions to Legislative Counsel, Ron Haven, basically he compared it to the apportionment plan. Basically is like mixing a U.S. senator's district being the whole state at large, and then at the same time treating this apportionment plan as if it entailed a congressional seat, a representative, in which districts are delineated. So that was basically the legal analysis that, among other things, that Legislative Counsel Ron Haven provided to us. So again, since this is a report by the HES committee to the NABI committee, and I've already heard that, there's several delegates that do it as view it as a controversial legislation, and certainly Navajo Nation Code allows for this item to be sent back as outlined, and I think that I would refer that particular aspect of the citation to Legislative Counsel Dana Bobroff. Again, it's this report, we're putting it before the NABI committee, and it's at their discretion on how they would want to proceed. Vice Chair Slater, I'll defer to you also to respond.
Honorable Slater.
Thank you. I think it's important to note a few facts about the consultation process or process. Actually, not true, but the committee ensured that we have these agency consultations and communicated with members. Many of the people who have spoken today have been engaged in this effort for a while and were present during a meeting or a conference held at Twin Arrows covering the transfer of authority and the ideas contained therein. So I don't think that it's fair to characterize it as this is something that was done down to the wire. And I also don't think it's correct that 4A was the primary plan. I think that the proponents of that plan, which is the status quo and not changing anything, wanted it to appear that way. And that's how things were presented. Now, when you go and you review the testimonials at the agency presentations and consultations or public hearings, there are essentially under 10, I think, non-school board members who speak. And when you review the materials, it's primarily the same school board members who are speaking over and over again across different agency council, or not agency council, but agency public hearings. And I think that that's very important to note, because why weren't there more parents? Why weren't school boards able to mobilize more people to speak on their behalf to make a compelling case for the necessity of every single one for $875,000 in stipends plus travel mileage plus the ability to dip into our special education funding line items and all these other things? And then when you read the comments, I remember when we were reviewing this, there were only a couple where people prefaced their comments by talking about or trying to center the child in the conversation. What is the experience that our children are having in here? And that includes the school board members, that includes other leadership, but it was primarily school board members who were speaking again and again and again. And it was just saying, keep the status quo. So we asked them, okay, well, meet us halfway so we can think of how we can reformulate this, maybe make it more efficient. But the only response was a letter or a resolution saying just follow the law. So there was no effort to meet the committee or Doty or us halfway. It was all just arbitrary decisions on the number of school board members that might be allocated for each school based off enrollment. And you can have every statistics degree in the world, but ultimately it's just an arbitrary decision on what you think works with the number of students and the number of school board members. So there was nothing that then drove down into how do you assess performance and accountability of school boards? Because many of us on the committee were very concerned about that. We need to have a data-driven approach to education, and that includes all aspects of education, whether it's math scores, whether it's teacher performance, whether it's board performance. And again, crickets. There was no explanation. Instead, I and another delegate on the committee were attacked, insinuating that we were looking down on the intelligence of school board members somehow, which I personally was incredibly offended by because A, I did not say that, and B, from my own personal experience and my family's experience, I mean, that's the complete opposite of what we've engaged in. Elevating local, non-Western educated leaders into educational leaders. But we have dozens and dozens of schools and an inefficient system across the board for running all of them. So there wasn't, you cannot say that the Navajo people said overwhelmingly, we don't agree with this. Every single chapter meeting that I went to, and many of my colleagues, other meetings, I presented this. And it was unanimous at each meeting that there needed to be some sort of change in regionalization. And then when you tie it into this broader project of trying to unify and better resource the BIE school system, funded schools, maybe that 10-year-long project that meeting at Twin Arrows was about, that will never happen. There will never be any sort of serious reform across the Navajo Nation in terms of education, unless there's some reform on the locally controlled schools and how those boards work. So that to me is important to recognize, is that we will never be able to make those long-lasting important reforms, better resourcing our schools with the current funding constrictions, without really reimagining Navajo education and being innovative. And that's what I'd like to share. You know, it's just so critical that said, you cannot say that the Navajo people overwhelmingly oppose this. You had the same school board members going from the agency public hearings to agency public hearings spouting the same information. I wouldn't say information. There was no justification for the status quo. It was just, we like it and we're comfortable and that's it. But it's like, well, what about the students? So if we want to start treating this as a controversial legislation, it is definitely going to set the precedent for intrusions of all committee members into each assignment. It's way too easy. It's way too slippery of a slope. And I think we need to be very careful there, because once that precedent is set, it could really spell the dissolution of the efficient workings of council, of the committee system. And what Chair Henyo said yesterday is the decision's been made. You got to stand in unison on it. But this is really the first step in government reform and how this council addresses government reform and what we think about it. But most importantly, what are the benefits to the people? In this instance, it's the students, centering the students. So thank you for listening, but I'm very with the idea of trying to escalate this, because I'm not sure you can do that post legislation has already passed. And if that's the case, then I'm going to start requesting some serious legislation be reviewed from the Resource and Development Committee, the Law and Order Committee, and the Budget and Finance Committee, effective immediately. It's a bullying tactic and the same tactic that the school boards were saying to us. I don't appreciate it.
I don't know if there's anybody else from Health, Education, Human Services coming.
If I may, this is Delegate So.
Oh, yes. Honorable Charlene, so floor is yours.
Thank you. To all my colleagues. I have to speak on this issue. I know that we are responding as a HES committee, but I have to state my stance, which I have taken yesterday. I voted against this, primarily the fact that, I disagree with what Honorable Slater did say. Yes, we're trying to keep some status quo, but then again, some of the underlying issues that he just pointed out, that could be addressed at a different time or under different circumstances, I believe. Overall, just the responses that I've got, people were calling me late last night as well, and they were asking me why Plan 6, and there was a conflict of interest with Matthew So being there and presenting this plan as well. I know that yesterday I had a difficult time going through via teleconference just because of the phone reception. But under Title 11, Section 11, this has to be recommended back to HESI. I believe that we're not following through on this matter well. We're not doing it efficiently. And right now I agree with my colleagues, Honorable Mark Freeland, Otoso, that, this is an issue that we're just taking an overview, 6 members over the entire nation, and we're controlling what the outcome may be for our students' education. And right now, this is strictly a voter elected official equal representation issue, is my standpoint. And, public comment was supposed to be held for 60 days, and that wasn't done. That was the issue that I had as well. And, again, this emphasizes that this is strictly an election issue, a voter's right issue, a fair and equal voter representation issue. And that law prescribes the criteria, but Plan 6 does not comply with that. And I had to get double feedback last night after Matthew So did state that it does comply with the law. But I had other people concur, and then some debated that with me last night. So I just need this to be on record that, I tried, I know that we didn't try well enough, and HESI, it just seems like the input wasn't there. I know that this pandemic has played a huge part in this, and I think that participation should have been much more likely increased. And right now, I just don't see it. I haven't been able to support this. I don't know whether my colleagues, if we can revert this back and then recommend this back to HESI. And so that is my point. Yeah, thank you.
Oh. Colleagues, let me go ahead and go to Miss. There was a request, I guess, of understanding from Honorable Vice Chair Walker. Let me go ahead and go to Vice Chair Walker's request to Office of Legislative Services. Actually, Legislative Council, sorry.
Do I need to walk that way? Okay. Oh, I did not want my picture taken here. Okay.
No, you're fine.
Good afternoon. Can you hear me? Okay. So 2 NNC 164 A14 states that all resolutions appointing public officials and significant or controversial resolutions may be referred to the Naabik'iyati Committee for discussion prior to being certified or enacted at the discretion of the Speaker by referral from a standing committee having final legislative authority, or by the written request of a delegate who is not a member of the standing committee which considered such resolution. The committee may refer a resolution back to the appropriate standing committee for further consideration. Now, this is your clause, your Title II clause on controversial legislations. In this particular situation, the legislation was certified. The HESI legislation was certified earlier today. So the controversial legislation clause is meant to be applied before the legislation is certified or enacted. So at this point in time, you don't have the opportunity, the option to use the controversial legislation clause, regrettably. A couple of options that come to mind are alternatives. One, there could be legislation dropped to rescind this legislation, but it will always, HESI will always be final authority. Another option, and there may be more, these are just off the top of my head, but another option could be some type of emergency legislation to delay the implementation of the statute or of the apportionment plan for, say, 30 days or so, to allow additional public comment. And there may be other options. I just don't know them right at the moment. I hope that answers your question.
Thank you very much, Ms. Barbara. Thank you very much, Ms. Barbara, for those suggestions. Colleagues, if there's representation to move down that direction, Ms. Barbara is willing to help any delegate assist in meeting those requirements and getting something together. But again, if there is anything that comes back out, you have to know that this legislation is final authority at Health, Education, Human Services Committee. And even if we were to extend it, or if there was somebody to rescind this, sponsor the rescission, those all depend and go back to Health, Education, Human Services Committee. Even if it was a controversial legislation moved to NABI, then it would eventually still go back as just recommendations at NABI, and then they would be referred back to Health, Education, and Human Services Committee, and it would be up to Health, Education, and Human Services Committee to go ahead and move forth on the recommendations that came back from NABI. Oh, I don't have anybody else. I hope Vice Chair Walker that helped assist in the process. I don't have, Melissa doesn't have anybody to text in. I don't have anybody that has text in. Not. Going once.
Speaker?
Going twice. Oh, Honorable Keelan.
Speaker, Delegate Paul Begay.
Okay, well, let me go to Honorable Keelan, then Honorable Yellow Hair, and then Honorable Paul Begay.
Shay, did you hear my
Keelan Begay, I didn't hear anything until you just now said, Shay, did you hear? Then you cut out. So go ahead. The floor is yours. Honorable Keelan. Let me come back to you, Honorable Keelan. Honorable Jimmy Yellowhair. No yellow hair. Honorable yellow hair. Going once.
Hello, Speaker team. Aaron the Tashanat Arnie 24 Councilman. Shekro Jimmy L here in it. Black Mesa Councilman. Diba Bayash TEA Black Mesa Chapter 4 Slate, Whippoorwill, Pinion, and Hartera. As I went through all the chapter meeting and my community up there is they didn't want to go to this plan by Doty, and they want to have to remain as is with these support the school board members that are on board now, and they don't want to lose any of the school board members, and they don't kind of trust Doty's how they're going to operate. Even now, the Jesus Simon Nashiko, 108 aro Doty, but it's no aro no Doty as they vote on them. It is so the shin so the shin. As the can be caro a to that nothing. Suchiata ki area about this devotion at Ani council neatly. By all due respect, not Ani. As committee, thank you for the plan. But when this reality comes, I had to vote probably no on this one here, not Ani. Then the bias statement not. I don't know that school board or not a fault to these some school have failures at the lower grades at no either the school board they either no could I so the solution at on yeah speaker should not thank you very much yeah.
Okay, thank you, Honorable yellow hair. Moving on down, Honorable Paul Begay.
Speaker, I'm back online, Kealan.
Okay, I'll come back to you, Honorable Kealan. Honorable Paul Begay. Okay, let me go back to you, Honorable Kealan Begay.
Shay, Delegate Daniel, so Isiki at neck Esco at Skin Sako at Ano Ila Isi Penia, Joita Bendo J La Obey a Cashin Bendo J Ila Isiki Hino Kid A Papa Night that neck.
Let me go on. I'll have that response when he comes back on. Let me go down the list right now. This is the list that I have. I have Honorable Otto So, Honorable Stewart, and then I'll go back to you, Chairman So. Honorable Otto So.
Hi. Thank you. Yeah. The final authority is within the Committee of Health. And we have these schools out there that are miles and miles apart, especially when you get into Western. Yep. The drive from Tonalea to Cavito is about a good 30 miles, maybe 25 miles, 20 miles or something. The drive from Cuba City to Cavito is probably about 35 miles. So there's that distance. Shanto also. Then I don't know, from Cuba City to Kayenta, about 78 miles, 80 miles. I don't know, you have the community of Chilchibito. I just not know it's Katna. Ako, the old Katnas, Niliki, Dans, the what, Nas, Nil. Ako, and the individual, the community members there, the public hearing, maybe in Chilchibito, maybe there was one there. I don't know. But I understand there was 5 public hearings, 1 in each agency, on a certain day. Maybe those individuals were working. That's a really good point that's later brought up. How come that the school board members didn't bring up a lot of parents there? Remember, the hearing is during a weekday. And then but I believe in Western, there's probably only 1 meeting that was held, and I believe it was in Tuba City. I tried to make that meeting, but we had a committee meeting, and to voice my opinion on it. And there was one statement I believe that came out was that the school board was at Twin Arrows throughout Navajo. Yes, they were there when the work session happened. I believe the school board members were not given a chance to speak at that meeting through the whole process. They controlled the meeting. That's the way I saw it. And at the same time, they were trying to push the I call it the takeover. The takeover. Alcohol. It's not a takeover. It's still taking over the BIE school. At those work sessions, at those meetings where the school board individuals came who represent the Navajo people, just as us, as delegates. School board members, the Navajo people voted for those individuals to be their voice. My school board members that were present at Twin Arrows weren't given that time to speak at relating to the school of Gray Hills High School, nor even Tuba City Boarding School. Alcohol. Nabel Sole, Nabel Casole. Sonat Ani, Ani Higit Ego. Adesh Ego Push Bizarre, it's up. They're just against us, There's a reason. Hajot Ado Laban, Toho, Koso Ado Lape, Nahat Agi Pepe, Danson, Old Aban Saske. I don't believe that Plan 6 is what the Navajo people want. And the school board members are the voice of the Navajo people also at the local schools. Just as we are as delegates. What do you mean? This just shows that the Navajo people's voice was just flushed down the drain. That's the way I see it. Those communities out there. And that's my concern. Alcohol. Alcohol. I really am disappointed in it. But somewhere, somehow, we have to make sure that we get something based off of the need of the Navajo people out there. If the Navajo people want to reduce it, let's put 2 options there. Put 4A and 6 together, and have them do a referendum and I at the Naya Kidoli. Ako ay abikaw indo ka. Ako on the say my stance is I don't support the legislation. I know it's a final authority of the HES committee, but if this legislation went to NABI, I'd be voting against it. If this legislation went to council, I'd be voting against it because you'd naked in a shahado. I don't the idea how to do na shahade. Ako I see ako adi it was about yeah.
Okay, with that, moving on down, this is the later Honorable Stewart, then Honorable Paul Begay, then Honorable Charlene. So, Honorable Stewart.
Thank you, Chair and fellow colleagues. Regarding the reapportionment, like Mr. Octoso stated, school boards are elected like we are. And they, I think that not taking away any local school boards will abide by their policies. But as a school board member myself, with over 1,905 students and overseeing multiple schools, it makes it easier in what I see, because then we have what was stated earlier, the BIE, you have your private, you have your charter, you have your public, you have other schools that have their policies that I see the vision of the education overseeing, then they have their policy, what we put in, what legislators have put in before. On that. Put out a policy that they need those, all that, I thought they have their own. To fill those policies, those test scores, thought they need on. If we have this condensed, then we have more money going back to the schools to provide those services to the students, whether it be tutoral, whether it be advancing their reading books, their workbooks, getting staff back in there to provide that type of service for counseling. That's where these additional money will be looked at as well. I see. So for this, I am glad that the move that HESI has done for this to move that in that way. So I support this initiative, and that's just what I want to express, Chair and colleagues. Thank you.
Hey, thank you, Honorable Stewart. With that, moving on, Honorable Paul Begay.
Thank you. Thank you, Shatai, Chair Raymond, and committee members. Yeah. Yes, this is a very touchy situation, it's a touchy issue. I thought when we had our HESI meeting, we kind of agreed on 4A, but apparently it went the other way based on the amendments that were done on Plan 6. I was pretty satisfied with 4A because I represent the northwest corner of the reservation, Western Agency. My main objective was trying to get the Chi'i chapter to be written in with the Kaibito border, the grouping that Kaibito had, because my representative comes out of the Chi'i chapter, representing Richfield Residential Hall. And so the only way that he can be able to get re-elected back in there is if the Chi'i chapter was included with the Kaibito grouping. And I thought that was what was done. And I do know that in the Western chapters that I represent, they are in favor of 4A plan. But as it is, it went the other way. And it's kind of difficult when you're teleconferencing and you don't have all the papers in front of you, your spreadsheets and all the numbers, the groupings that you're talking about. So with the new amendment, it made it so that Richfield Residential Hall had a separate representation. And that was the only reason why I voted for that. But when you really think about it, this reapportionment plan is it covers the whole Navajo reservation, and it's each delegate's responsibility to allow representation from their area to these schools. And so I'm kind of wishing that I didn't vote the way I did yesterday, and I don't know what the procedures would be, but if there's any chance of rescinding this legislation, I'd be the first to sponsor that legislation as a member of the HESI committee. And I'd like to ask for the advice from our chair, Damon, or legal counsel, if that would be their if that would be possible to do, because as mentioned by some of our colleagues, there's a lot of people out there that are not happy with the decision that we made yesterday, and I personally was split between this decision also. But either way, 4A or 6, I think I'm satisfied with Richfield Residential Hall's representation and the Chi'i representative serving on the Richfield board. So again, Chair Damon, if there's any way to any procedure I need to follow, I'd like to go on record to say that I'd be willing to sponsor this, to rescind this legislation, if possible. Thank you.
With that, moving on down, Honorable Charlene So.
Thank you again, Chair. I just have one question for our Chief Legal Counsel. Let me see here. I know that with this Title 11, the strict election issue, I was wondering if this can be remanded as an election procedural maneuver, perhaps as voters' civil rights issue. That's my question. And just for the record, I know that I just spoke with or I just texted Daniel So, and the minutes from yesterday does it showed it green for this. Well, in fact, I did not, but it was counted as green. So just for the record, I wanted to state that. Thank you.
Okay. Thank you. I know that there were some questions from your colleagues, Chairman So, and then I'll go ahead and refer over to Honorable Paul Begay and Honorable Charlene So's from the chambers here. Chairman So.
Thank you, Speaker. Chair Damon Otto, colleagues, as chairs of committees and vice chairs of committees know that the discussion and the debate is driven by the membership. Even though, as chair, you try to influence the committee members to go one way or the other. But in this case, the Plan 6 is what, in all aspects, is what the committee chose. And as chair, I have to certify that particular decision. Regarding Ms. Charlene So's aspect about, there was yesterday, because of the high winds, there was, her call was cut off several times. And so I think that that's where she missed out on a lot of the discussion, and basically we would provide her time to get back on the line. And I know that on the amendment, she voted against it, and then her telephone line or call went blank, and then she came back on and voted on the main motion. So just to put the aspects on public record. The other aspects, the aspects that Vice Chair Carl Slater referred to as the delivery of education to the Navajo children. That aspect is put to the side, and it's now in the area of voter participation, voter rights, and in that aspect, it's certainly at the discretion of the school board membership, as well as the members of the council. The decision by the committee has been made, and it's certainly the aspect of rescinding and coming back to the committee as delegate and Honorable Hess member Paul Begay has spoken to. That rests with him and the other members of the council. The other aspects of part testing, Mark Freeland talked about the part testing. We know that the state of New Mexico is developing their alternative, and Che Freeland and myself were going to for legislation to basically afford the aspects of going to the alternative testing. The other aspects about the quality of teachers, unfortunately, that rests with the school board. And to bring it into this conversation, then it's like it rests with the school board. The basic part that I think is in the apportionment plan. Are there equal numbers of students represented? The school board apportionment plan does talk about the apportionment plan will be based on school enrollment by chapters or within a particular school board's enrollment boundaries. And in this new era of accepting students from outside their enrollment boundaries, it just makes it appear that the school boards and the school administrators are just using having a dollar figure over the students to make or break their particular school budget. And for me, that's almost unconscionable. And so then when we looked at 4A, it was, yes, it didn't get unanimous consent from every agency hearing. And that part, but the majority of commenters basically supported 4A. So, again, like I said, the chair certifies what the committees, what they motion to and what they amend. And so at this point, you know, I stand with what the HES committee voted on. And again, if members of the HES committee want to rescind the legislation and re-debate and re-look at the whole thing, aspect, that is at the call of the members of the HES committee. The main thing, the driving force was last week, the council voted not to delay the chapter elections for 1 year. The chapter elections involves the chapter officers, the land board, grazing committees, as well as school boards. With the timelines in Title 11 and Title 10, we needed to get this apportionment plan in place so that those seats that would be up for election would the community members, the chapters, and the school boards would know for what positions they needed to file. And so that was the driving force to get this apportionment plan approved to meet the parameters of the law, of the election laws. So that's the other aspect that really drove the committee to basically get this apportionment plan approved. The other parts regarding the education plan, the quality of teachers, the park testing, those, you know, basically remain part of the actions of the school boards. So with that, I hope that answers the discussions of the committee. the other part, Shananda Che, Ki Alan Bigay, Kodo at Nick Echo, he had it just sitting the store quaggy. Only Nastatin Asai Khahata the Education Committee. Ita Sebetindo Sepi Bespas and Dundon Bineta Ita Sepi Education Committee. Tanas Ligi Ad Dibe is on Higi Adelia apportionment plan. Din Naha Ho Quaggy Nakastole Sto Cannot Atole. You see, بالناتش إيجي إنلا تقول خدنا هذا عند بالخطأ هو يستوعي enrollment boundary إيجي بكهو هذا بكوي شن حاجة دارت خارو داك خيجو خد نازنل بالخطأ هو يستوعي بكهو دي والخ بننت not necessarily تهدوني هذا وش أتينا هو وتأ أنا الإن أكودي كواجي كده هو الشيء يا كسبة سننت أكو أنت كيسيجي جو كواجي vice chair خاطري إذا لا يصير بانتا كيستو ليجي أشنا في خجو إذا هوش أتولي أو ناس كده كاهو لا إسكاهو استو لا وتهو قلت خد نيجي جو استو بانتا كيس يا University to college to add.
Oh dear.
Add خطأ إشكاهو. هذا أدو خجو خطأ لقوا أكيد. Junk scholarship pada hades on the
Okay.
College preparatory class. Hajo yigaho the math will yagi English to science digi high school course yigi nahadon ba anata ne ko nasket the kako Hajo college level course of the Yotkato Legi digi so quaggy on Saz Kezo committee so Bila Tahoto me to the Dean Digi quaggy Hajo Ndokas. Which is بناتش وتا the سكاد حتين دو تا قلت بنات بند قلت ديتشي بنات I think لكن نزاتين دو تستين داشية board members Ado Ajabeso but edit Agi Kato di Kojo Achin either her dos Ado based on Dante to Leto a quaggy bond as case or a quaggy Tani Nilo even Nacha 80 committee Igi state or link means a quaggy apportionment plan, plan 6 will you the kidney also a less what need I thought email nature HEHS05-20 auto a quaggy to a plan 6 quaggy representation quaggy itasto auto committee members Pastosing Plato Bahasito Les Quaggy Hazo Aya like that is I get you get that to change to ada Iliagi change to Plato or you Baha's snaggy snaggy Plato change Plato sa became to committee members. Without any non-audibly HES committee. Mr. Chair, Speaker Damon, without I would respond to the colleagues.
Thank you, Honorable Chairman So, for that. I do have one more response from the Vice Chair, and then I can go over to Ms. Barbara regarding the questions from Honorable Paul Begay and Honorable Charlene So.
Speaker, I don't need to comment.
Okay. That, I guess, to Honorable Paul Begay, the question was into the Speaker's office. You just had to come in or talk to Madam Chief Legislative Counsel to fill out a form to start the process of rescinding legislation, health education AP-05-20. And then that would start the ball in order for you to sponsor that legislation. To Madam Honorable Charlene So, your question, let me go ahead and refer that to Leg Council.
I keep trying to look into my, talk into my microphone, but I need to talk into the computer here. Delegate Charlene So has indicated that her vote is not recorded right on the legislation. The recommendation, after some consultation with the Office of Legislative Services, that if she so wishes, she should send a written challenge or a written memo to the Office of Legislative Services and copying the Speaker about the challenge to her vote. The vote will then, after it's verified by the recorder and others at the meeting, then the legislation would be have to be decertified to be corrected. So the vote could be corrected during the time that it was decertified. Your controversial legislation clause could kick in. Somebody would, of course, have to act on that. So I think that answers my question, Delegate So's question. As far as Delegate, what do I do?
Yeah, I just
the question about putting this on the ballot referendum, or putting this as a referendum on the ballot, That has many different steps involved. Right now, it is in your code as the responsibility of Hess to actually go forth with a referendum. The referendum would have to take that authority out of the code. So you would have to have code amendments, numerous steps that my office would need some time to research. Thank you, Speaker. You can have this back.
All right. There's no more comments, questions. I don't have anybody from Jalissa. I don't have anybody on this side. Honorable so.
Mr. Speaker, I think one thing that we need to look at is the school board issue is a reservation-wide issue relating to the Navajo communities out there, and I believe I look at it as the same scenario as council, and if anything, I believe if it's going to go to a referendum, so forth, relating to school board officials and things like that. That way, you don't have leadership making decision upon another group of leadership, their fate. And I believe if we give this to the Navajo people to determine, that would be fair and square. Because a lot of what is, I believe there was one comment that a child's success, whether he or she passes or meets grade level, is determined based off of the school board member. That's not right. And the child's success was determined based off of school administration, not the school board. It's not upon the school board member to determine the child's fate in education. If spending is somewhat an issue, just like how the 88 council was reduced down to 24, and it was due to expenditure. And if that's the case, let's give it to the Navajo people. Let's give them the option of option 6, all the options, 1 to 6, and have the Navajo people determine that number of school board. Okay, that's just a recommendation that I have, and maybe that will shed light. That way the Navajo people will say, this is what we think.
Speaker.
Okay, colleagues, again, please mute your phones. There's numerous different discussions you can hear. And right now we have 46 members that are looking online, and I have 1, 2, 3, 4, 5, 6 individuals that have their phones on that are not muted. Please mute your phones, colleagues. I don't have anybody else.
Speaker, this is Delegate Elmer Begay.
Honorable Elmer Begay.
I have a question. Speaker, I just wanted to ask why
Health, Education, Human Service Committee was empowered to redistrict the voting district for school boards. And who gave them that power, or why did they do that? Because when voting redistrict has to be approved by the council. That's how the other the reapportionment plan was set up. There was a law was already a law that was approved by the council. So right now, what my son Otto mentioned about that, why only 5 council they're redoing this. So I want to know that why, who gave them that the power to do the redistricting. That's my question. Thank you.
On by Naabik'iyati, when the government was overhauled into the 3-branch system, to the temporary government status that we're still currently in back in the early 90s, the council approved it that way. Then when the council readopted it and collaborated and combined a couple of different committees back in 2010, when the delegates went from 88 to 24, that just reassured it. So the council was the one that identified that and actually delegated that authority to Health, Education, Human Services Committee. Maybe Ms. Barbara, if you can clarify that even more.
Thank you. So the authority of the Health, Education, Human Services Committee to approve this is the reapportionment plan is, I believe, in Title 11. So it was council who did that delegation. If you want maybe further history or some recitation of some of the provisions, my understanding is Ron Haven from my office is on the line. And he could perhaps give you that information, Delegate Begay, or we can send you an email with it if you would like. Thank you.
Speaker.
Elmer Begay.
Thank you for the response. But this is a Navajo Nation-wide election redistricting issue. And I don't think it's right for only one committee to make that a very sacred decision. People forgot the school board members or elected officials. The school boards are still elected officials. That's my question again.
Honorable Elmer Begay, my suggestion, then Ms. Barbara, if there's anything different, or Mr. Haven, you're on the phone, is that this was delegated back to Health, Education, Human Services Committee. If you're wanting to change it, just as indicated, back to possibly putting this to a referendum that Ms. Barbara indicated, you would definitely have to go back and change the code, amend the code, and give this authority back to either NABI or back to council. That's something that you can definitely do, but it would take some time in order for you to work together with Office of Legislative Counsel to develop those legislations, and it would probably be at least a minimum of three legislations, I would think. One to delegate, transfer to another committee, one to get approval, and then the other one to authorize to get that completed. But that's up to any delegate. It has that authority too as well on a brigade to change that provision and be the policymaker and decision makers. And that's something that would ultimately go back to council. But at this time,
All right. Thank you.
according to Title 11, Health, Education, Human Services has final authority, and maybe Ms. Barbara, if you could email that provision out to all my colleagues that shows that HESI does have final authority on this decision.
He will do that.
Okay,
Thank you.
all right. Maybe it might be in Title 10. I'm not too sure. Well, they'll get that information. All right. I don't have anybody else.
Speaker David.
I don't have anybody else on.
Continue. Speaker David.
Chairman Indio.
Yes, I'm finally back online here. I've been in and out, but one thing I wanted to point out yesterday when I listened to the deliberation for Health, Education, and Human Services Committee, they went through extensive debate regarding this legislation that they passed, and at the end, I felt that as Chair of Budget and Finance, I need to be respectful of the decision made by the committee. And since they're final authority, I believe that the delegates that voted green were understandable of how they were voting and what kind of impacts it would have. And at the same time, this is a government reform initiative, which is a long time coming. It has to start somewhere. And people are afraid of change. They don't want to change. And even with this pandemic, you'll see we're told to stay home, but we don't want to change. And where we at now, we're out and about. We don't want to change, and it's the same situation. The way I see it here is that we don't want to change. We want to keep it the way it is. Nobody telling us what to do. And so I applaud the votes that were made by the committee, and I encourage them to stand strong either way they voted. Either if they voted green, they voted red. If they voted for Plan 1 or Plan 6 or whatever, they need to stand strong together as a committee and move forward with how they felt this plan should go. And for me, as a delegate, I don't want to infringe on. I'm respectful of their authority, but we start infringing on the authority of other committees. Then I see Delegate Eugene So's legislation as being more valid now. That's where we want to do away with the committees and just do one big old committee where we can all have our hands into that pot. So Health, Education, Human Services Committee. Again, reiterating what I said yesterday, stand strong and do what's best for the committee. Yeah, no, Speaker Damon.
Okay. Thank you, Chairman Henio. Okay, we have two new players. And the time now is 2 o'clock. Honorable Halona. Delegate Halona. And once. Halona.
Speaker. Hello.
Yes.
I don't know what's wrong with my phone. It went out, but I'm shut that one off. Okay, there we go. Am I still on, speaker?
You are on.
Thank you, sir. Colleagues, Naabik'iyati. Just let everybody know that, it wasn't done in secrecy. We've been talking about this for several months now, since this last summer. And that was coming up. This was coming up. The only real people that I heard complaining about this decision was mostly from the school board members. And that's because they all wanted to keep their jobs.
You know, we all had a chance. Everybody had a chance. All the delegates had a chance to come out to the public hearings, to voice their concerns, or to come to the meetings that we were having when we were having this on the agenda. We've been talking about this issue for a long time. So now the decision is made. You're all running to the committee here, telling us that we didn't do a good job. And I resent that because we were meeting on this for several months.
Point
We
of
had
order.
the chance to come
Chairman
out.
Point of order.
Chairman is here.
Chairman is. Point of order.
Honorable Halona, not all of us are against the decisions of committees. Let's get to the point and get this report over with, and let's vote on it. Thank you.
That's not a point of order, Speaker.
Thank you, sir. Let me finish this up.
Halona.
You know,
Go
yes,
ahead.
sir.
Halona. Go ahead.
Okay, so, you know, with all the public hearings that we had, we made our decision. We're going to go ahead and go forward with it. However you guys decide that you don't like it, I'm sorry that's the way it happened, but, you know, we made our change from 88 to 24 as far as the council is concerned. We survived. This is the same process that we're doing with our school board situation. Nobody likes change. But look at it, from 88 to 24, we survived. This is what needs to happen right now for our school system. The other thing that we need to look at is maybe make tighter qualifications for those who are applying for these positions. Everybody is saying that the school board doesn't teach the kids. No, but the school board does have control of the principals and the school teachers that are out there. And they've got rid of a lot of good people, a lot of good principals that were there. They got rid of them. We've seen a lot of controversy over this past year from all the different school boards. They're spending all their time, wasting our time. So making this change is for the students. I haven't heard anybody talk about the kids as far as all this change that we've been making all along the way. So I just want to let everybody know that we didn't take this decision, make this decision lightly. We already knew there was going to be controversy, but we waited for people to come up and come to the meetings and let us know what their thoughts are. A lot of the people that I talked to like the change. Again, I said that the school board members are the ones that most of the people that don't want to have the change, you want to go status quo. So with that statement, thank you very much. I just want everybody to know that, you know, we really thought hard about this. It's not something that we just woke up one night and said, we're going to do this and change it. This has been talked about for many, many years. Just like the student education program that we're trying to get with Dotech, to put all the school system underneath one organization under the Navajo Nation. This is still coming down the road. We still have to decide that too. So thank you very much, everybody, and have a good day.
I'm locked. Bobby.
Test. Okay, right, speaker.
Hey, thank you, everyone. If you want to go ahead and mute your phones, we can go ahead and get started. Let's go back onto the record. This is the Navajo Nation Council Naabik'iyati Committee meeting. This is a regular meeting here, Thursday, April 16th. The time now is 2:16 p.m. We did lose connection, but we are back on. We're recording. We're here at the Navajo Nation Council chambers. Numerous of my colleagues of the 24th Council are here within different areas, locations within Window Rock, and then also various locations across the Great Navajo Nation. With that, we'll go ahead and go back to a roll call. See who's all on the line. Bobby?
Elmer Begay. Key Allen Begay.
Delegate Key Allen Begay is here.
Honorable Key Allen Begay is present. Paul Begay.
Delegate Paul Begay is here.
Honorable Paul Begay is present. Nathaniel Brown. Eugenia Charles Newton. Delegate Charles Newton is present. Honorable Eugenia Charles Newton is present. Amber Crotty.
Delegate Crotty is present.
Honorable Amber Crotty is present. Herman M. Daniels, Jr.
Green.
Honorable Herman M. Daniels, Jr. is present. Mark Freeland.
Red chili.
Honorable Mark Freeland is present. Pernell Halona.
Halona is present.
Honorable Pernell Halona is present. Jamie Henyo.
Jamie Henyo is here. Yes, it is.
Honorable Jamie Henyo is present. Vince James. Rick Nez.
The man from San Juan River is here.
Honorable Rick James is present. Carl Slater. Rick Nez is present. I'm sorry. Carl Slater. Raymond Smith.
Present.
Honorable Raymond Smith is present. Wilson Stewart.
Stewart's on the line.
Honorable Wilson Stewart is present. Charlene So. Daniel So.
Delegate Daniel So is present.
Honorable Daniel So is present. Eugene So.
AJ Shea Wrangler, Eugene Augustus So, present.
Honorable Eugene So is present. Otto So.
Present.
Honorable Otto So is present. Thomas Walker. Edison Winika.
Thomas Walker is here.
Present.
Honorable Thomas Walker is present. Edison Winika.
Present.
Honorable Edison Winika is present. Edmund Yazzie. Jimmy Yellowhair.
Delegate Yellowhair is present.
Honorable Jimmy Yellowhair is present. The total of 18 delegates.
Speaker, I'm present. This is Delegate Slater. Having technical difficulties.
Delegate Vince James present.
Honorable Vince James present. Honorable Slater, Carl Slater is present. 20 delegates.
Okay, that 20 delegates that are present. 20 delegates are present. 21 with including myself. We do have quorum. That, go back to discussion. I know that there was one more individual that was on, and that was Madam Chair Charles Newman.
Thank you. Speaker, can you hear me?
The discussion. Yes, I can hear you.
Great. Colleagues, thank you very much. So I agree with what my brother, Honorable Hanyo, stated. We need to be respectful of those decisions that are made by committees, especially if they have final authority. My question is this legislation about the children, or is it about the school board? Because I think that's a big distinction. I would be remiss not to make a statement in this case. What I can say or what I can comment about is what's currently in place, and I know that what's currently in place is not working. Our children are suffering because they're not getting the education that they need and the education that they deserve. When we moved back here to the Navajo Nation, my son was a senior, and he started at Shiprock High School. He was in his senior year at Shiprock High School, was the same work that he was doing his freshman year while he was going to school in Texas. So he got bored really, really quickly. And he made it through his senior year not ever doing any homework. I couldn't believe it. And it was really frustrating for me because, again, he was doing the work that he did his freshman year. I hear and I've witnessed how school boards, they get involved in personnel issues instead of focusing on our children. As Honorable Slater stated, the status quo does need to change. I once questioned how the school's money, how they're spending that money. As I know, there's no measure in place that truly grades the decisions that boards are making that affect our children's education. I want to stress that. It's about our children's education. I heard a question, and maybe I was wrong in the way that I heard this question regarding the civil rights of voters. And I went in and what are the civil rights of our children who are receiving that education? And are those rights violated when school boards have too much power and education is not improved? In the end, it's our children who are suffering from the decisions that are being made. And I can say, as a mother who saw my child go through Shiprock High School, I can say that I was not happy with the way that the education was being provided to him. And it's so frustrating to see how these school boards, they're getting involved and they have way too much power. Now, that doesn't mean that I support Department of Education having all of the power, but I can say wholeheartedly that the education system is just not working. So I support the decision that's made by HES because they are the ones who grappled with this idea. And yes, it was a difficult decision to make, but as delegates, those are sometimes the decisions that we have to make and that we have to stand by. And I'm going to say that nobody likes change, but when change comes, there's experience that comes with it. And we cannot talk about how change is not going to work if we don't try it. And I feel like only then, when things change, can we really measure whether that change was a success or not. So, Shaja, Chairman So, as the chair of Law and Order Committee, I know that, again, sometimes we are left with those difficult decisions to make, but it's about our children, and it should children and nothing more. So thank you for listening. I just had to put my 2 cents in there because of what I was hearing. And I hope that we can focus on our children's education and make that the point and stick with it. Thank you.
Okay, thank you very much, Madam Chair. Colleagues, I hear someone's TV in the background. Or somebody's radio. You can still hear some of your discussions, colleagues. Please remember to put your phones on mute or your computers on mute. Thank you very much. I don't have anybody else. Doesn't have anybody else. So,
Speaker, this is Delegate
I don't
Crotty.
think there was anything back there. Crotty.
Thank you, Speaker. I hope you can hear me. I hope my colleagues are doing well. For all of our relatives who are listening on the Facebook page, thank you for your comments and providing suggestions. I think, Speaker, when we talk about our children, I absolutely agree that it should be from their point of view in terms of how our school systems are addressing some of these modern education challenges. And with that being said, and something that we have told Department of Education many of times, and if it wasn't said with this council, is to say that our schools are failing, also that's hurtful to the students themselves. The students are very aware of how adults are talking about them. And as adults, we need to learn how to have a better conversation about what are some of the challenges, how do we be accountable, how do we create systems that set them up for success. And I wasn't convinced that a dramatic reduction in the school board would produce those results. And that's where we need Navajo School Board of Education to be very progressive in changing and modifying Title X. We need Department of Education to continue to build their capacity so that they have certified, trained individuals that can oversee these schools. And with some of the questions from the delegates, we are talking about BIE Community Grant School Board. We have yet to start the discussion on public school boards and how, and that's predominantly that's predominantly where our children attend schools, or on the public school system. And so I would ask HES to direct the Board of Education and by a certain timeline to develop amendments to Title X. And as this new budget comes forward, how much money are we spending on our children? How much money in our budget goes to the Department of Education? And so that is a way that we can hold ourselves responsible. And from the school board, collectively, we should find out what are some of their challenges, whether it's getting children to school, whether it's communication, do they have the right teachers that they need? And we can be part of the solution rather than just saying, well, there's too many school board members. I'm concerned in the number 6 because I have small communities that have very distinct, unique challenges, and now combining them, I'm concerned that their voice will be silenced because we have larger communities that overtake the conversation. And so I also feel that delegates should have, in looking at this resolution, there should have been agency resolutions to support this and to have a dialogue at the agency so that everybody was notified. Thank you, Speaker.
Thank you. Sorry, Madam Chair Crowdy, to interrupt. The colleagues, there are 49 people on this call, and there are 16 individuals that have their phones that are not muted, and you can hear the background, and it creates that ripple effect, and it kind of makes that ringing sound too as well. Please, colleagues, put your phones on mute if you're not speaking. Thank you. Madam Chair Claudia, I don't know if you want to add anything else.
And I wanted to reiterate, as the council reduced to 24, we need to look at, have the people saved money? Have they saved money with the reduction? Because in my estimation and looking at the budget, there's really not a big savings of dollars. As every delegate, we got an assistant, and that's something new. A lot of money goes to travel. A lot of money goes to meetings. And matter of fact, we're right back to the number of subcommittees that we had as 88. And so as we talk about government reform, I want to push back on that, because if we don't create systemic change, then a reduction just means a concentration of power and not necessarily a representation of voice. Thank you, Speaker.
Great. Thank you, Madam Chair Cardi. Is there anybody else? I don't have anybody on my end.
Chair.
There's nobody else.
Chair.
Yes.
This is Thomas Walker.
Vice Chair Walker.
Yes.
Floor is yours.
Okay, thank you. Committee members. Yesterday at the SC meeting, I did speak to the matter, the issue we're discussing now, and I did respectfully request the committee to consider, what we're doing now, to have NABI receive a report on the legislation. Because yesterday, before the vote took place, and now the vote is in, and it's been certified by the chairman's signature. So Abed said before that, I did what the law allows us to do as delegates per Title II, to request that certain legislation can be referred to NABI for a report. So I followed that yesterday, and it was not considered. So this discussion we're having today less out of respect for leaders, I do believe that we do need input in some matters, not.
Vice Chair Walker. Hold on real quick. Colleagues, please respect the individuals that are speaking. Please put your phones on mute. That ringing noise in the back, someone's phone's on mute. Vice Chair Walker, floor yours.
Okay, thank you again, Chair. So when we say that we need to respect the authority of the oversight committees, I think, yes, I do strongly support that and believe in that. Although delegate coming to a committee meeting, we always afford them the opportunity to speak. If they have a request, we try to address that also. Consider. But that's water under the bridge. That's yesterday. Moving forward, we did have a discussion on the matter and all the issues that were brought out. The legislation, reinforcement school boards deserve this kind of discussion. And we accomplished that. And I know a lot of other questions and
ideas, recommendations came out also. This matter probably deserves this kind of full discussion. Not saying anything about the HESI committee's authority, but matter that impacts the entire nation. That I think sometimes even as a matter of courtesy should be brought to council. So now we're being in a state of emergency where we can't even physically come together. It's twice or three times as hard to really get into these issues and discuss and understand each other, and give it a real thorough discussion. Naabik'iyati, that's why the committee such as the Naabik'iyati hoping that this would happen, and it did happen in another way after the fact. But I appreciate all the comments, questions that were made. I would leave in the hands of my colleagues, all of you. And then lastly, the Nabi is allowed to hear a report on legislation that's deemed as controversial. Controversy is in a way it just doesn't mean outright conflict, pros and cons, and doesn't mean hostility at all. It means there's a lot of questions, there's a lot of concerns. So what legislation. So that's the law as spelled out in Title II. So we're not doing anything that's not allowed. We're not doing anything that's out of the ordinary. This is allowed, and this is what as legislators, this is what we can do. So, thank you, Chair.
Hey, with that, I don't see anybody else. No one's on either list. Going once, going twice. There was no comments back to the presenter, so thank you very much. 3 times. We do have a motion, and we do have a second on this report. Motion by Madam Chair Charles Newton, second by Honorable James. That the roll call. Accepting this report.
Almer Begay. Key Allen Begay.
Delegate Key Allen Begay votes green.
Honorable Key Allen Begay votes green. Paul Begay. Nathaniel Brown. Eugenia Charles Newton.
Delegate Charles Newton votes green.
Honorable Eugenia Charles Newton votes green. Amber Crotty.
Delegate Amber Kenneth-Baugh Crotty votes red.
Honorable Amber Kenneth-Baugh Crotty votes red. Herman M. Daniels Jr.
I vote red.
Honorable Herman M. Daniels Jr. votes red. Mark Freeland.
Delegate Mark Freeland votes red.
Honorable Mark Freeland votes red. Pernell Halona.
Halona votes green.
Honorable Pernell Halona votes green. Jamie Henyo.
I'll vote green.
Honorable Jamie Henyo votes green. Vince James.
Nez.
Delegate Rick Nez votes red.
Honorable Rick Nez votes red. Carl Slater.
Green.
Honorable Carl Slater votes green. Something's going on. It won't let me. Eugene. It won't. Raymond Smith.
Green.
Honorable Raymond Smith votes green. Wilson Stewart.
Wilson Stewart will not vote on this one.
Okay. Charlene So. Daniel So. Eugene So.
So votes green.
Honorable Eugene or Daniel So votes green. Eugene So. Otto So.
Otto So votes red.
Honorable Otto So votes red. Thomas Walker.
Thomas Walker votes red.
Honorable Thomas Walker votes red. Edison Winika.
Green.
Honorable Edison Winika votes green. Ed Vinyasi. Jimmy Yellowhair.
Delegate Yellowhair votes red.
Honorable Jimmy Yellowhair votes red. 9 in favor, 7 opposed.
Well, before I recognize that vote, Honorable Stewart, you need to explain why you're not voting.
Hold on, let me go get him. Hold on.
Chair, isn't it the rule that we have to vote? And if they don't vote, there's consequences. Can you reiterate that, please?
Yep,
It may be
remember
because
that.
of the school board, but he's on a public school board, so this doesn't affect him.
He's on the state school board.
Okay, I'm back.
Stewart.
Yes, sir.
Honorable Stewart, can you explain why you're not voting?
I had text the staff. I was in text with the staff, and I asked them to ask Dana if it would be right if I vote. And her legal counsel, she said just to abstain from voting. That's why, sir. And then the other reason being is because I'm on the state school board, so I don't know if that's a conflict, even though it's a report.
Okay, so you're just saying that the reason why is because you might have a potential conflict of interest.
Yes, sir.
Okay. Okay.
Point of order.
What was the vote? Point of order.
Speaker. Well, that.
Yes, Honorable Otto So, point of order.
With the conflict that's in place, whether it's the school board and the community that the Honorable Wilson Stewart represents, presenting a conflict, well, how much of a disenfranchisement would it put on the amount of people that he represents within the 3-4 chapters he represents there? And the voice of those 3 chapters will not be counted or be voiced as this relating to this matter of voting, and he is present, and I believe there's consequences to that, Speaker. Thank you.
Question of privilege, Speaker.
Question of privilege. Honorable Freeland.
I don't know.
Is that Honorable Freeland with the question of privilege?
Yeah. Are you there? Hello?
Question of privilege.
Sorry. Speaker, regarding our little brother's vote, is there, and this may be a question for Dana or for legal counsel, would it matter, or is there a distinction between public school board versus BIE school board? Thank you.
Let me go back to Honorable Otto So's with the disenfranchised. I don't know how many registered voters, Honorable. I don't have that number in front of me, Honorable Otto So. But you have to think what we're voting on too, Honorable Otto So, to all my colleagues. This is accepting a report. If this was accepting more of a position statement or entitled to a policy change, and then we would have to do definitely some more research on this. But I can go to Ms. Barbroff and clarify that question. So, Honorable, especially to the question of privilege from Honorable Freeland.
Good afternoon. As just a reminder, because it's hard to keep up with all of these citations, but in Title II, Section 191, that speaks to conflict of interest, and it says, committee members who have personal, family, or business interests in matters before the committee shall not participate in the committee or joint committee proceedings or vote on the matter. It has always been the position that it is the council delegate himself or herself who knows has the most details about whether they have a conflict or not. From what I understand, Delegate Stewart is saying whether or not he has a conflict, it may appear that he has a conflict, so he has chosen not to vote. This is accepting a committee report. It's not voting on the legislation itself or amendments or such. As far as Delegate Freeland's question about the differences between school boards, yes, there is a difference, but there's technical differences, but I think that Delegate Stewart's identification of a conflict is still valid regardless of the difference between school boards. Thank you.
Thank you, Zach. Colleagues, with a vote of 9 in favor, 8 opposed, speaker not voting, and Honorable Wilson stated that he's not voting due to the potential conflict of interest. That, colleagues, moving on down. D, report of Wayne Claw and Chinle Nursing Home and any Wanika Nursing Home. Mr. Halona.
Speaker
Speaker
Kellen.
Are you on the line, Honorable Halona?
Speaker,
Yes.
this is Delegate Daniel So.
Honorable Keon McGee first, and then Chairman Daniel So.
I just want to clarify that we have two precedents. Now we know that delegates going to start sending or making any action in subsequent reports. Thank you.
Chairman So.
Yes, I basically, when we get to new business 7, I would like to suspend the rules so that we can do a consent agenda. And I'm basically wanting to put that on record so that after we finish the report and old business, then I'd like to, at new business, I'd like to make that particular motion.
Okay, Honorable Chairman So, just to let you know, we still have a report from Wayne Claw and Shinley Nursing Home. And then also we do have finally the individuals from Dotech have stated that they're ready to present to as well. So before I go back to Dotech, I think the report from Wayne Claw is up next on the Tinley Nursing Home and Winnica Ward Nursing Home. Honorable Halona. Honorable Halona, the request was from yourself. Honorable Halona going once. Honorable Halona going twice. Honorable Halona going 3 times. Okay, with that, we go back to the report from Dotech. You're on the line, right? It's Lenora Henderson. Are you on the line?
This is Leonora Henderson. I'm here from Dotech.
Okay, great.
Yes, I am. This is Leonora Henderson. I'm here from Dotech.
Ms. Henderson, and then also Dr. Jill Jim. Oh, she knows she had to leave. Okay. Well, Ms. Henderson, the floor is yours on Daltex. Just get on an update.
Good afternoon, delegates. My name is Leonora Henderson. I am from Dotech. Dr. Jim is not here at this time. She is out of the office, but asked me to go ahead and proceed in providing a report. As of right now, there are 11 senior centers closed throughout the reservation. These are due to staff that were in contact with individuals that had tested positive for COVID-19. So we have allowed the staff to go home to self-monitor, and they're under quarantine for the next 14 days.
Ms. Henderson, can you hold on real quick? Hold on real quick, Ms. Henderson. Anybody on the call, if you're monitoring the monitoring it on a TV or something, we can hear the ripple effect. That's the reason why it's sounding that it has that echo. So colleagues or staff, anybody on the line, if you have your phones on and you're listening in, please put your phones on mute. Ms. Henderson, go ahead, continue.
Mr. David, do you want me to continue?
Yes, continue.
Okay, as I was saying that some of these individuals, the staff were in contact with individuals that had tested positive for COVID-19. During this time, they are at self-monitoring. They're in quarantine for the next 14 days. The first incident that happened was in the Mexican Springs and Tehachapi area. That was about 2 weeks ago. So the staff from that area are back at their senior centers. The next one was just this past week in the Newcomb, Two Gray Hills area. They are still out on their 14 days. The most recent one is Inscription House and Gutty. They are out and they are being tested as well. So those just an update on those senior centers. However, the other senior centers are continuing to provide home delivery meal services to the elders that are in most need of food. What the protocol is, as far as delivering foods, is to drop their meal boxes in a container of some sort that is near their home where the elder can reach it. And the staff have already talked with the elders to make sure that they do this. And some elders are also refusing meal packages from senior center staff and do not want senior center staff to go near them. And we are keeping documentation of that. As we speak, delivery of cleaning supplies and PPEs are still being shipped to each of the agencies. The agencies were requested to provide invoices or quotations several weeks ago. Or I think it was last week. They were provided. The command center did pay out about I think it was like $20,000 worth of cleaning supplies and PPEs. So that's just basically in the vendor's hand now as to when they will ship those supplies to the agencies, due to the shortage of all of these items that are needed reservation-wide or worldwide. So they're getting these supplies. As far as operating hours, each agency is working. They are at their senior centers Monday through Friday from 8 to 5. They are cleaning, they are sanitizing, they are updating on their reports, doing data entry, which that still needs to be done, data entry for Arizona and the state of New Mexico. There are reports being provided to them. They are requesting reports on daily basis, I should say. So those are being submitted as well. The center is closed to everyone. No one is allowed in there but the staff. So the staff are pretty much okay when they are. They're protected when they are at the senior center. The only risk there is when the staff are delivering the food to the elders, but even then precautionary protocols, measures were provided for each agency to abide by to decrease the spread of this virus and also to not risk exposure to the elders. I guess that is all I have for now. I'm not sure if you all have any other questions. Thank you.
Hey, thank you very much, Ms. Henderson. That, colleagues, is there a motion? Motion once.
I'll motion, Speaker. This is Delegate Crowley.
Second, Freeland.
I'll second, Speaker.
Freeland,
This is Delegate Charles
second.
Newton.
Okay, it is comments, questions.
Speaker, this is Delegate Crotty.
And Chair Crotty, go ahead. Floor is yours.
Thank you, Speaker. Thank you, Ms. Henderson, for your report. And so with the senior centers that you have identified, first, I want to state that I recognize that the Navajo Nation is in a pandemic and that we are all trying to do the best that we can. My concern is we have been on other calls with other tribal leaders, and we know how community spreads, and we know that the source of some of this community spread can be originated from the individuals who work at senior centers. And so with that being said, I'm very concerned about the monitoring and the screening of your workers and what is your plan to keep them safe. So first, it's the screening and monitoring to make sure that their exposure is low, and if they are have symptoms, what is the process for providing notice? I represent Gadiai chapter, and I'm very well aware of how that situation unfolded. I've talked to chapter officials, chapter staff, and received emails from the program regarding that issue. My concern is we do know that employees share households with other family members. And so we know that other senior centers workers have been exposed. And I am near the point of, well, I am frustrated in terms of why we're not being proactive to allow those workers to isolate. So if they show any symptoms, and have an alternative plan to provide food to our elders. And why I'm saying this is it was very publicly known that President Nez was in the vicinity of an exposed first responder. Once he was made aware that he was exposed, President and Vice President went into isolation. That same courtesy should be given to our employees. And many on the ground have had exposure to this individual, and I believe they should also be given that time to self-isolate to see if they have symptoms. And while they're self-isolating, we can develop an alternative plan to provide food to our elders in a very safe way. Our elders rely on that food, and I believe it's up to us as leadership, working with executives, to make that as safe as possible. I did read, and this is where I will say there's contradictions from the command center, because if volunteers are required full PPE equipment, then our employees should be given that same courtesy. If they're on the front line, they're essential, then there needs to be a plan from command center on how to properly protect them, to give them the supplies that they need so that they can sanitize. And gloves are just part of that solution. And then the last thing that I would say, and what's important, is the mental health of the employees. I think it gets to a grave point, and out of desperation and fear, not only for themselves and their families, but for the clients who they love, who are part of their community members, where they want to make it safe. And if we don't have a plan, and if we're only allowing a few senior centers to close, but yet others have been exposed, I think as a council, we need to step in, and we gave millions of dollars to the emergency relief effort. There's millions of dollars that have been donated. We can at least provide PPE type of equipment for the employees, or develop an alternative plan. And an alternative plan, I have some suggestions, but I think that also goes back to the program manager, the division director, and the command center, knowing that this is a spot that has been identified as a weakness in our system. This is not just the senior center, it's also the food distribution program, it's the CHR program, and individuals, advocates, shelters. Our essential employees who are giving direct services are not provided the proper protection that they need. And I would say although we're looking at hazard pay, that just is just part of the solution. So I wanted to raise that in a report and hear from my colleagues on some of their suggestions, and then develop a directive, because for me, this is about accountability, and that's why I requested this report. Thank you.
Okay, thank you, Madam Chair Crowdy. Moving on down. Honorable Wilson Stewart.
Okay, thank you, Chair. Colleagues, again, good afternoon. And Ms. Henderson, good afternoon as well. Thank you for your report. I just wanted to know that just to make clarification, that you did say you are also representing Dr. Jim as well in this report. So since she's unavailable, I will address my questions to you regarding the incidents that have come before me again as well. So through the Special Diabetes Program, it has been brought to my attention that the Cayenta staff that were working at the Incident Command Center were put on 14 days quarantine. Yet, through the request of the Special Diabetes Director, Program Director, who made the request to Dr. Jim to allow them to come back to work earlier than their 14 days quarantine. And they are working inside the Division of Health building at this time. The other one is what funds or how is the assistance coming from the Division of Behavioral and Mental Health Services? Since they have funds available, federal funds available, how are they assisting with that? That has with what we're dealing with now with the pandemic. The other one is what you already stated, Ms. Henderson, is the Dotech staff, but I still have some of the chapters that are still contacting me from the program, saying that they still need gloves and masks as well. But I'm sure you're aware of that. And that's it, Ms. Henderson. Going back on mute. Thank you, Chair.
Okay, with that, Honorable Freeland.
Okay, thank you, Speaker Otto, Naabik'iyati committee members and staff. Thank you for that report, Ms. Henderson. We appreciate it. I, too, am concerned for the safety of our Dotech staff, going with no PPEs and knowing that they are continuing to do that. I do check in on the staff out in the centers directly, and their biggest concern is making home deliveries with no PPEs. I know that's not you do as much as you can, Ms. Henderson, but that comes down to the Health Command stockpile or supply. But we really need to help our employees get protected. I think what Shmayaja brought up is real important, the mental health aspect. Employees are afraid, and that's been voiced to me numerous times, and I don't blame them. I don't blame them. They're doing their due diligence and providing a service to our elders, which is really important. But if we can't help them, what's the nature of our duties to our employees? So we really need to, and I wish we could have Health Command on these calls, but, it sometimes feels like it falls on deaf ears. I hate to say that, but it does. But really, I want to reiterate that protection for our staff, knowing that when this all started, closures occurred in Eastern Agency that was made by the agency director, the program supervisor out there, which I agreed with, and I guess they got called back. The agency director, agency supervisor was overridden by Dr. Jim, and they were called back. And there was a lot of questions at that time as to why. And there was a lot of unanswered questions that went about, and I was doing my best to encourage staff and let them know, I did submit a 213 asking that question, but it went unanswered. And, I think we really need to support the staff. Their mental health is important, as well as their ongoing efforts. What they're doing each and every day, they don't know if they're infected or not. So there's a fine line that we need to remember that we're putting the staffs on. And with adequate PPE, I think it would be a little bit more different. But we don't have that proper protection, Santa. So I just wanted to say that. But thank you, Ms. Henderson, for that report.
Hey, moving on down, Madam Chair, Charles Newton.
I'm here. Can you hear me?
Yes.
Hello? Okay, great. Thank you for first Shadeja for asking for this report, because I have been receiving information as well from senior citizen centers here in the Northern Agency, and I think that the points that have been brought up are valid and they're concerns that I have. But I guess in a direct fashion, what I want to know is, when are we going to be properly providing for our senior citizen centers? And I say this because we know that right now it's PPE gears, but prior to that, there were questions about food deliveries, there were questions about supplies running out, about us inadequately supplying the centers. I received an email from our PS2 asking for assistance. I had to reach out to him and ask him what he needed at this time, and he did provide me a list. But I know that there is also other senior citizen centers that are running out of supplies, primarily the folding, the styrofoam type of folding plate that they're currently using. And I did email Dr. Jill Jim, and normally she's pretty good about getting back to me, but for some reason I didn't get a response back from her right away. And I agree that we need to take care of our staff, and we need to ensure that they are being protected, because what scares me about the first responders and those essential staff who are out there is they come home to their families. They have families. And every time I go to Window Rock, I worry about bringing something home to my husband. I guess the virus, bringing it home to my husband. And I try to, be very careful with that. But I know that there is a lot of staff in the Senior Citizen Center who are reaching out saying that they're not being protected properly. So again, my question is, I want to know the timeline. I want to know a specific date of when you're going to start providing PPE gears to our senior citizen staff who are having contact or who are making deliveries of food. Thank you.
Okay. I don't have anybody else on my listing. Nope. Honorable Otto.
Yeah, I guess my question is, there were some orders that was needed in Tuba City relating to delivery trays and so forth that the senior program was lacking, and the PEP. We did ask for an update from the incident command, but we have not gotten anything yet of that nature. One I would like is that maybe you could email it to me. How many PPE and delivery trays were sent to Tuba City? Because I believe Tuba City has been trying to ask for this information, and this is probably about 2-3 weeks ago, and I'm hoping that you guys address that issue. I know when I know some staff were told, don't talk to your council delegate and so forth. But I guess if you want the deliveries to continue to happen, the basic things that need to be in place relating to PPE and the employee health, I guess that information needs to be provided to council. That way we're not shooting from the hips and shooting everywhere. And but if you can, give me that information in the email form. That way you could respond to me directly. Other than that, that's my questions for now. Thank you.
That Honorable Alona, are you back on? Nobody else. Let me go back to Mrs. Henderson.
Okay. Thank you, delegates, for your questions. And I'll just briefly touch on several of the questions that you had all asked and inquired about. So let me go back to when the first declaration was announced back on March 13th, and so it began on March 16th. During that week, I had a conference call, Dr. Jim and the agency staff, as well as the senior center staff, regarding the stay-at-home order and the jobs and the responsibilities of the senior center staff. We also provided training on COVID-19. We also had the staff go and finish their FEMA 100 and 700 courses. We also requested of the staff to provide a plan as to agency work hours, staffing schedule, feeding plan, and also recommended which services that need to stop for now, which is everything else but the meals. We also requested for agencies to provide me with a list, not a list, but a quotation of the PPEs, the supplies, the food trays, any cleaning stuff, sanitizing supplies that they needed to operate within. We weren't sure how long this would last, or we still don't know how long this will go on, but they did give us the quotations, and like I said, that order was placed. And in those orders, they include the masks, their gloves, their hairnets, their aprons, their Clorox, their sprays, their sanitizing wipes, just cleaning equipment for their buildings and their vans. So during that time when that order was processed, the check was issued to these vendors, agencies were in contact with the vendors, where the vendors stated that they are not able to provide them with their whole order right now because they were on back order, or they didn't have that supply, that item in store right now. So the vendors did say they were going to uphold on their end, but they'll be delivering the supplies as they come in. So say, let's take Shipbox. Shipbox ordered supplies. All the items that I mentioned, they were ordered. They're in that invoice. And as of right now, I'm not sure if they received any of it. and only because the vendor is short as well. I know that Crown Point, Chinle, Tuba City are working with butlers. Fort Defiance is working with Norchem, and we're also getting some food trays from Blue Mountain Meats as well. And so far, all agencies have received gloves. Each agency received 9 boxes. And these boxes contain probably about 10 packages in each box. So 9 boxes went out to each agency, and it was up to agency to distribute to their senior centers. Then just this past week, we received the shipment of delivery trays again, and those were distributed again. Anywhere from 9 to 12 boxes were distributed, and it was up to agency to distribute which senior center was in most need. As you know, most centers are not all serving. Some are closed due to the chapter compound closure that was mandated as well. So I just want to, I know there's a real concern for wanting to protect our staff, and you know, I'm with all of you. I agree with all your concerns and your issues, and yes, I want all of these PPEs out there for our staff, and we are getting them. We're not forgetting about our staff. I worry about them, but it's all in the orders that were already placed, and even now, I'm asking the agencies to gather more quotations, to plan ahead. This is going into, what, 3rd, 4th week now? So I asked them, I said, plan ahead, look ahead, see what you would need if your center is still just going to be operating as delivering meals. So they're gathering quotations again, and we are, once I receive those, I'm going to be starting compiling it and submitting it to the command center again. I am aware of the funds that are available for Dotech for that purpose. So that is my plan right now. I do keep in contact with PS2s almost on a daily basis, so we know, and I'm informed and aware of the situations that are going on in their agencies. And I just want to say, well, that's most of the questions that all of you all had. So I just want to say thank you, and I really appreciate your support and all of you in advocating for us, for Dotech. Thank you.
Speaker, this is Delegate Cotty.
You have a follow-up, Madam Chair Cardi?
I would. I'm not sure if there's any more questions. I think, Speaker, it sounds like Ms. Henderson in her capacity is requesting these supplies. What I want to say is gloves are not, it's not, when we're talking about protective gear, we got to talk about masks, we got to talk about gowns, shielding, other things. And so council did pass with that $4 million, about $500,000 for our senior centers. Can I ask staff to get a report on how that money is being used? It's been 4 weeks. We need to know how that money is being deployed. I know that conventional vendors are back ordered, but so for northern chapters, we received an opportunity from a company to purchase PPEs. And so that's why I'm just baffled why PPEs are not being provided to our employees who have funding, and we just need to connect them with the right suppliers and vendors. And that's a concern when everything now is bottlenecked in Window Rock, and I understand that from a command point of view. But again, this is the flaw. If we're not advocating for our employees and looking at alternatives, and especially not part of the decision-making process, then we'll continue to find areas like this. So I did mention it's Dotech, it's CHRs, it's food distribution, and it's others who are providing direct service to our community members. And I would ask Leonora if you could shut down more of the centers who have had contact with the individual from Gadiai.
Hey, Madam Chair Crotty. Let me go back to, I have two new individuals. Honorable Otto So, then Honorable Brown.
Speaker, I was just waiting for an answer. I'm good for now. Just delegate so.
I know me.
Okay, Honorable Brown. Honorable Brown going twice. Honorable Brown going 3 times. Let me go back to Ms. Henderson. There was a question by Madam Chair Crotty.
I'm sorry, Delegate Crotty, what was your question?
Crotty, if you want to reiterate that question.
My question is, of your funding, how much have you spent on PPEs? Also, what is the turnaround when you make a request? I'm assuming all hands on deck to get these supplies out. So what's the turnaround for you to submit and receive supplies? And then how much more money do you have regarding that emergency amount? And if you need more funding to protect your employees and to make sure our elders have food?
Sanderson.
Delegate Crotty, to date, we have spent about $120,000 rounding off. Those are the ones that purchased the supplies that I just spoke about earlier. And when there is a request that comes in, I do submit the 213 to the command center. The turnaround time from the beginning was minutes, but within the past week or so now it's days. So, but they're still responding to our requests, and a lot of the requests that are coming from them as well are requests from other individuals regarding PPEs for Dotech staff. And as I said, I asked the agencies to provide me more quotations as to more items, supplies that they need. And once I receive those, then I will email you and update you, and I will be in contact with you if we do need more funding.
And my other second part of the question is, are you, I'm asking to isolate the Dotech personnel who were in contact with the staff member.
Yes. The procedure is when we are informed of that kind of a situation, someone being in contact, we We immediately sanitize the senior center buildings, and we have the staff leave the senior centers tight. Most of them, if they're not experiencing symptoms, then they are told to stay at home and self-isolate. But if they are experiencing issues, they are to go to the hospital and get tested, which they have been doing. The command center, that is the protocol that we use once we report these situations to them. And the individuals that they have been in contact, namely the elders, names are all given to the command center as well. And this is where CHR deploys and makes contact with these elders to ensure that they're informed of contact with someone of that COVID-19, and they are monitored for during that period of time, that 14-day isolation period as well. CHR does that part of it.
So if that's the protocol, if someone is in contact, I'd like to be courtesy copied on that email to Northern Agency Dotech so that the personnel can identify if they've been in contact with that individual, so that they can isolate and be part of the conversation for the alternative plan when you have Dotech members who need to be in isolation.
Okay.
Okay. There's no other comments, questions. Honorable Brown, can you hear me? Honorable Brown. Honorable Brown, if you disconnect and then recall in. Let me go ahead and go on to Honorable Slater.
Thank you, Speaker. So I'll make a brief comment on communication. Ms. Henderson, I've spoken to a lot of staff throughout Chinle Agency, and the morale is definitely very, very low. And they feel there is a lack of communication and support for what they need. Some of them are saying, well, we're supposed to be doing like a curbside delivery. Then you go to the program supervisor asking for what that protocol is, and they can't deliver that, saying that one hasn't been delivered, but that's the expectation for distribution at certain sites. On top of not having masks in certain areas that have become hotspots. So our request is to put together a comprehensive budget report like Delegate Crotty requested, so we know how the funding is being used and where it's going, and then to continue to support your staff and think of some novel ways to improve morale so that they feel positive performing this essential duty at this really difficult time. And then lastly, we could get a follow-up that comprehensively explains existing policies across the nation, or if it's on an agency by agency level that's in writing, something that we can share with either chapter officials or confirm with our constituents, because a lot of the verbal communication isn't effective for creating a paper trail and documentation, which stands to support accountability within our programs. So if you can, write that down, explain what the existing policies are, then it will make everyone feel like there's a consistent set of rules and everyone's on the same page. And I think that will go a long way in improving morale and the safety of our elders. Thank you. Yeah.
Honorable Brown. Honorable Brown. Okay.
Chair, point of privilege.
Honorable Daniels.
Yes, thank you, Chair. Thank you, colleagues. Yeah, I got that. It's from Senegi. The great, what the speaker said that this morning, the great staff in Lenigi, the great 5 o'clock, it is not so. You have a papa and see kids to listen to you. I don't know about Shin so the hand not so. So, area, we have a lot on our agenda legislation. Or the date sort of let it go. It is about ban case or little colleagues. Chair, thank you.
With that, colleagues, I don't have anybody else. Is there anybody? Honorable Brown cannot get in on the line, so he's texted a message. This is to Ms. Henderson from Honorable Brown. He wants to know is it possible or is there a mandate that we can have for all senior center staff to get COVID-19 testings as a precaution? That's from Honorable Nate Brown, Ms. Henderson.
Delegate Brown, there is no mandate in place right now, but I sure can look into it, and I will update you on that.
Okay, he through the either through himself or through the speaker's office will work together with Nate Brown to get that recommendation to not only to Dotech but also to the command center. Just as an FYI. All right, there's nobody else. Going once, going twice. Who says I have anybody on? I don't have anybody. Going 3 times. Roll call to accept the Bobby. Roll call, accept the report.
Almer Begay. Key Allen Begay. Honorable Almer Begay votes green. Key Allen Begay. Paul Begay. Nathaniel Brown. Eugenia Charles Newton.
Delegate Charles Newton votes green.
Honorable Eugenia Charles Newton votes green. Amber Crotty.
Delegate Amber Kenneth-Crotty votes red.
Delegate Amber Kenneth-Crotty votes red. Herman M. Daniels Jr.
I vote green.
Honorable Herman M. Daniels Jr. votes green. Mark Freeland.
Freeland is green chili. Thank you.
Honorable Mark Freeland votes green. Pernell Halona. Jamie Henyo. Finch James. Rick Nez.
Delegate Ricknez votes green.
Honorable Ricknez votes green. Carl Slater.
Green.
Honorable Carl Slater votes green. Raymond Smith. Wilson Stewart.
Stewart votes green.
Honorable Wilson Stewart votes green. Charlene So. Daniel So.
Daniel So votes red.
Honorable Daniel So votes red. Eugene So. Otto So.
Red.
Honorable Otto So votes red. Thomas Walker. Edison Wanika. Edmund Yazzie. Jimmy Yellowhair.
Delegate Yellowhair votes red.
Honorable Jimmy Yellowhair votes red. With a vote of 7 yeas and 4 opposed.
Seven in favor, 4
Opposed.
opposed. Honorable Keon Brigade was green.
I didn't get those ones.
Honorable Keon Brigade was green.
Okay.
Honorable Nate Brown. Those are the two they can list it in problems. So 9 in favor, 4 opposed. Speaker not voting. Anybody? Okay, that 9 in favor, 4 opposed. Speaker not voting. Motion carries to accept the report. With that, moving on down. Report from Mr. Wayne Claw on Chinley Nursing Home and Annie Waniki Nursing Home. So we did get a text message from Honorable Helona. Mr. Wayne Claw is unavailable at this time. He was available earlier today, but now he's not. So moving on down. Old business, none. New business. Chairman So, you did indicate that you wanted the floor back when we get to new business. So yield the floor to you, Honorable Chairman So.
Yes, I'd like the motion to suspend the rules so that we can move to a consent agenda.
Chairman So, on your consent agenda motion, which legislations?
Legislation 50-20.
50-20.
51-20. Legislation 53-20. Legislation 87-20. Legislation 89-20. And legislation 88-20.
So 50-20, 53-20, 87-20, 89-20, and 88-20.
And 91-20.
Okay, 91-20. Did you get that? Okay, so that's 50, 91, 53, 87, 89, and 88. There's a motion to have those items as a consent agenda by Chairman Daniel So. Is there a second? Honorable Yellow Hair, second. Questions, colleagues? Going once?
Our brother has a question here.
Any objections?
Honorable Stewart.
Honorable Stewart.
Yes, Chair. Question on 88-20. I have a concern with that.
Okay.
Or a question with that.
Well, if you have a concern with that, you can ask for that to be taken off, and it will be.
Okay, I request that one be taken off, the 88-20.
Okay. So now the legislation, or the motion is 50, 91, 53, 87, and 89.
Is 91 on there, Speaker?
Yeah.
Yes.
50, 91.
88 is taken off. Delete 88. So on our agenda, that's A, B, C, E, F.
A, B, C, E, F, E, F.
A, B, C, E, and F. Hey, motion second. Any other comments, questions? Going once.
Speaker.
Going to Honorable Freeland.
Speaker Jay, would it be okay if we discuss item B?
You got to delete it off. You're gonna have to say you don't want it on the agenda or the consent agenda.
I mean, we could talk about it tomorrow, but it'd be better if we talked about it now. That way, tomorrow we can just vote on it.
No, you can't talk about it at council. It just goes straight to the vote. You had to talk about it at Nabi.
Okay, can we talk about it?
So that means you don't you don't want it on the consent agenda?
No.
Hey. So legislation 50, 53, 87, and 89 are the only ones on the consent agenda. Again, 50, 53, 87, and 89, just those four. Well, once, twice, three times. Go ahead, roll call, Bobby.
Elmer Piquet. T. Allen Piquet.
Just a second.
Elmer Begay votes green.
Honorable Elmer Begay votes green. T. Allen Begay. Paul Begay. Nathaniel Brown. Eugenia Charles Newton. Delegate Charles Newton votes green for the consent agenda.
Honorable Eugenia Charles Newton votes green. Amber Canasba Crotty.
Delegate Amber Canasba Crotty votes green.
Thank you.
Honorable Amber Canasper-Crotty votes green. Herman M. Daniels Jr.
Green.
Honorable Herman M. Daniels Jr. votes green. Mark Freeland.
Delegate Mark Freeland votes green. And I also have a text
Honorable
message from our older brother, Allen Begay. He also votes green. Got a text message.
Honorable
Thank you.
Allen Begay votes green. Honorable, no.
Don't recognize that. Keelan Begay. Keelan Begay needs to text into Jalissa. Colleagues, if you can't hear, you have to text Jalissa, not your colleagues, because we print it out from there. Thank you.
Okay. Honorable Mark Freeland votes green. Pernell Halona. Jamie Henyo. Vince James. Rick Nez.
Delegate Rick Nez votes green.
Honorable Rick Nez votes green. Carl Slater.
Green.
Honorable Carl Slater votes green. Raymond Smith. Wilson Stewart.
Stewart votes green.
Honorable Wilson Stewart votes green. Charlene So. Daniel So.
Daniel So votes green.
Honorable Daniel So votes green. Eugene So. Otto So.
Green.
Honorable Otto So votes green. Thomas Walker. Edison Wanika. Edmund Yazzie. Jimmy Yellowhair.
Delegate Yellowhair votes green.
Honorable Jimmy Yellowhair votes green.
Honorable Keelan Begay votes green. Honorable Nate Brown votes green. Honorable Pernell Halona votes green. Honorable Honorable Swanika votes green.
Unif. Hold up. There we go. Unif is still on the line.
Go ahead. Yep. Lock it down. 15 in favor, 0 opposed. Motion carries. That straight to new business consent agenda. Item number A, legislation 50-20, legislation 53-20, legislation 87-20, and legislation 89-20. Mr. Patera, if you could read them to the record.
Legislation 0050-20, an action relating to Naabik'iyati Committee and Navajo Nation Council, confirming the appointment of Robert K. Black to the Commission on Navajo Government Development for a term of 2 years as the representative for the executive branch. Legislation 0053 20, an action relating to Naabik'iyati, Naabik'iyati supporting HR 5510, a proposed congressional act, a congressional bill amending the Help America Vote Act of 2002 and entitled Protection and Advocacy for Voting Access Program Inclusion Act, legislation 0087-20, an action relating to Naabik'iyati supporting the New Mexico State Court ruling in Yazzie Martinez versus New Mexico that the state of New Mexico and its public education department failed to meet its constitutional responsibilities in the education of at-risk children, including Native American children, opposing any and all efforts of the New Mexico Public Education Department seeking dismissal of the case, requesting complete compliance, including adequate funding for education of school children as mandated by Constitution. Legislation 0089-20, an action relating to Naabik'iyati Committee supporting the Navajo Nation Executive Branch position statement relating to a recommendation for the implementation of Title V coronavirus relief funding for tribal governments to the U.S. Department of Interior and U.S. Department of the Treasury. Mr. Speaker.
Okay, colleagues, 53, 87, and 89. Final authorities here at NABI. 50 goes on to the Navajo Nation Council. That, roll call. Oh, motion, actually, sorry. Motion, colleagues.
Freeland.
Honorable Freeland. Second.
Second, Daniel So.
So. That. Roll call.
Elmer Begay.
Elmer Gay votes green.
Honorable Elmer Begay votes green. T. Allen Begay. Paul Begay. Nathaniel Brown. Eugenia Charles Newton.
Charles Newton votes green.
Honorable Eugenia Charles Newton votes green. Amber Canas-Bacrati.
Delegate Amber Canas-Bacrati votes green. Thank you.
Delegate Amber Canas-Bacrati votes green. Ermin Himdan Jr.
Green.
Honorable Herman M. Daniels Jr. votes green. Mark Freeland.
Freeland votes green. Thank you.
Honorable Mark Freeland votes green. Pernell Halona. Jamie Henyo. Vince James. Rick Nez.
Delegate Rick Nez votes green.
Honorable Rick Nez votes green. Carl Slater.
Delegate Slater, green.
Honorable Carl Slater votes green. Raymond Smith. Wilson Stewart.
Wilson Stewart votes green.
Honorable Wilson Stewart votes green. Charlene So. Daniel So. Eugene So. Otto So.
Green.
Oh, Delegate Otto So votes green. Thomas Walker. Edison Wanika. Edmund Yazzie. Jimmy Yellow Hair.
Delegate Yellow Hair votes green.
Honorable Jimmy Yellow Hair votes green.
Eugene Stowe votes green.
Honorable Keelan McGee votes green. Honorable Nathaniel Brown votes green. Honorable Paul McGee votes green. Honorable Chairman Hino votes green.
Eugene Stowe too.
Chairman So votes green. Hey, that's it. $15 in favor, 0 opposed. Motion carries. Moving on down on the legislation. Legislation 0091-20, sponsored by Honorable Chairman So. Mr. Botero, if you could read into the record.
Mr. Speaker, members of the committee, tracking numbers 0091-20, an action relating to Naabik'iyati Committee and the Navajo Nation Council, overriding the Navajo Nation President's veto of Navajo Nation Council Resolution CMA-14-20. Council is final authority. There are no amendments. Mr. Speaker.
Colleagues, is there a motion? Honorable Otto So, motion. Second. Freeland. Comments, questions on 0091-20? I don't have anybody on the. You have anybody just?
I'd like to say something, Speaker.
Honorable Freeland.
Thank you. Do I need to let Che present first?
Yeah, because you're going to be saying something. We're going straight to the vote, then no. So, Chairman So, 20 minutes.
Thank you. Now the Chaos Kit committee members, Otto, Cecilia, Otto So, thank you for the motion, and Che, thank you for the second. Basically, as we discussed numerous times so far, and the council addressed it with CMA 14-20. And it refers to basically to increase the medical resources available to the Navajo people. And during this COVID-19 emergence, and that's the basic reason I'm pursuing this particular override, because there are federal dollars available that would go to the managed care entity of Molina and Nautani Development. So, should this have been already approved, those folks would be the boots on the ground, helping to educate, helping to provide essential resources, whether it be the staple goods for of this particular pandemic. So there's not much else to say. I think at the previous NABI committee meetings and at the council session, we've had thorough discussion. And it, without any further ado, I'd like to just open it up for questions and comments. Thank you.
Thank you, Chairman. So you can go to the board or go to the floor. In this case, going to Honorable Freeland. Floor is yours, Honorable Freeland.
Thank you, Speaker. I appreciate you all giving us a chance to present this. I understand this whole concept completely and fully, my colleagues. I look at this as a huge, huge opportunity for the Navajo Nation, economically as well as for our people. We've continuously asked what does our economic future hold and what is the direction of our economic future. That's a big question that's unknown right now. We need to start thinking about creating new revenues, driving new revenues for our general fund. Thinking outside of the box, how can we create new revenues to prepare for the future of the Navajo Nation, the great Navajo Nation? I think it's time that we start looking at other means of revenues and driving how we can drive our economy. This concept is nothing new. It was adopted from the early 80s. And, I think with the president's veto, his message was very clear as far as stating that, the Navajo should have a choice. And they do have a choice in this. But really, other companies in the state of New Mexico are making money off of our Navajo people. Why not bring that money back here to the Navajo Nation General Fund, to the Navajo Nation Treasury, instead of it going to shareholders on Wall Street or to executives in Chicago or board members? There's 3 other managed care entities right now that have Navajos enrolled: Presbyterian, Blue Cross and Blue Shield, and Western Skies Community Health. Now, those 3 companies right now are the ones who are making huge profit off of our Navajo people, and I really stress its importance because this is an opportunity for us to create that revenue source for the Navajo Nation. And I wish, I understand, I wish the president had come to an agreement with that, because this concept is real important. Why not have the first Indian-owned managed care entity in the United States created at the Navajo Nation? Why not have that? We're going to start something innovative, something new, something creative. And this is really an exciting project. The governor's waiting for us, and I'm glad, Che, you dropped this legislation, because it basically states that this will be the official position of the Navajo Nation, and I wholeheartedly support this, Che, and your legislation. So the concept of managed care entities having passive enrollment, we need to be able to get started on this project. Thus, the passive enrollment. If they don't agree with this project, or they don't agree with the managed care organization, they have the opportunity to opt out and go back to their original managed care organization. But think of it as us building our economic future of the Navajo Nation. And really, I stand, like I said, with Che on this, and I appreciate the opportunity to speak on this, Chair. Thank you.
Hey, any other comments, questions, colleagues? Anybody text in, Joyce? Naabik'iyati. Naabik'iyati. Naabik'iyati.
Speaker, this is Delegate Delmer Begay.
Hold on, Honorable Begay. Chairman Hino, can you hear me? Chairman Hino. I have Keon Begay and Chairman Henio. I want to speak. Hold on. IT staff, IT Byron. I have delegates. I have Chairman Henio, Keon Begay, Raymond Smith, Paul Begay, Nate Brown, Honorable Wanika, Honorable Helena. Cannot speak.
Speaker.
Hold
Damon.
on, real quick. Let me do this. Yes.
On your end, is Key Allen Brigade muted?
I don't have Keon Begay on.
Okay, the cell number is 602-574-1404.
It doesn't show me those, Honorable. It just shows me callers that call in. It doesn't actually show me the actual number. But this is
Delegate Day, Speaker.
Hold on. I'm unmuting everybody right now. Hold on. Honorable Keon Begay, can you hear me? Honorable Jamie Henio, can you hear me?
Hello there. Hello.
Jamie Henio.
Hello. Hello.
Who's this?
This is Henio.
Oh, go ahead. Chairman Henio, floor is yours.
I was hoping that would have been recognized when you were doing the consent agenda, but it's too late now, so I'll wait.
Okay. Ollie, we unmuted everybody. Can you let me see. Hold on. Four people start muting. Honorable Keon Begay, are you out there? Jay.
This is Delegate Keon.
Oh, there you are. Jay, you're full.
I sent my question already, Speaker.
Go ahead. Go ahead.
Hello. Yeah. My question is that if we do the override, will the management care quickly start working? Unless this is just going to be a position statement by the council. Speaker.
All right, those are the only three we have right now, right? Everybody else, let me go back to Chairman Stowe. Chairman Stowe?
Oh, yes, thank you, Chair Damon, Otto, Key Allen Begay, thank you for that question. Basically, the reason we are seeking this legislation, number one, the Navajo Nation Council is the governing body of the Navajo government. And the Speaker, the President, basically has the veto power. So with this override, then we will be able to, the Nation Council, Navajo Nation Council, now will be able to approach the governor of New Mexico, Michelle Lujan Grissom, to say the Molino Healthcare Natani Development Corporation is the official Indian managed care entity as provided within the Department For human services, where the managed care entity will be able to access that are afforded to MCOs. Mr. Chair, that's my response to Che Kialan-Begay Jr.
Okay, great. I don't, but Elmer Begay.
Good afternoon. I have a question. I know that we understand the concept, but the question that I have is, I know that what we're giving to them, to Marlena Healthcare, will be, is it a different pot of money that they'll be getting? Because or the supplies that they're trying to get, I'm pretty sure is coming from the same national debt stock that they have for all these supplies for PPE. So I was wondering if there's another company that they're going with that they can get these supplies. I know it's limited. I saw elsewhere it's all like that. So I was wondering if there's another company that they can go with, and then also that the normal process can take 2 years, but we're trying to get them to be on fast track to have the governor to approve it for immediate service. So my question is that right now, is there the reason why we're trying to get this supply? Is it a different company that they can go with? And then also the funding that goes to IHS or 638, is it the same money they'll be getting it? Are they different fundings that they'll be getting separately from where usually the 638 are getting funded from? That's my question.
Hey, Madam Chair Crowdy.
Thank you, Speaker. Colleagues, so I'm reviewing the legislation and I'm reviewing the veto message. I think where I'm conflicted and I'll need the sponsor to provide some guidance. I am reading, Speaker and my colleagues, a press release from the President supporting legislation, the original legislation that Chairman So had sponsored. So this is a press release from January 22nd from the Office of the President and Vice President. And in this press release, his administration supports the development, so it says the Nez Leiser administration recently informed New Mexico Governor Michelle Lujan Grisham of its support for legislation number 0367-19, request the governor and the state human service department to work with the Navajo Nation, Natani Development Corporation, and Molina Healthcare to implement Medicaid services. I will state for the record, I have been a delegate, and Delegate Freeland can attest to this in the work with MCO in the prior administration. I am still very hesitant in terms of how we move forward and how our citizens are engaged in this process. But what's not clear is the road in terms of the administration publicly stating they support this and signing the legislation, and now as we move forward, this veto. So I need clarification in terms of what has changed from January 22nd to the veto that we now see mid-March, which is merely 6 weeks in between time. I would need that question to be answered. Thank you, Speaker.
Speaker Damon?
Okay, Vice Chair Smith.
Speaker, can you hear me? Speaker,
Yes, I can hear you.
thank you. Finally. Question is, once this veto override, is the governor going to honor without the president's consent? That's the question that I have on that. We're going to be pushing this along. I'm in agreement with getting Molina and getting these services out, because this is a pandemic and we need to move forward. I'm just wondering if the governor is going to hold off and know what the president's position on, because it's coming from the legislative side. We need to be in unison. That's my question to
Hey. Questions? Any other comments, questions? Melissa, is there anybody? No, let me go back to Chairman So.
Okay, thank you to Shaja, Honorable Elmer Brigade. Basically, it's a different pot of money than what the 638 hospitals operate on. The 638s are basically funded through the Health and Human Services Department to the IHS, specifically for Indian Care Health Services. The Medicaid dollars are also funneled through Department of Health and Human Services and into CMS. And CMS is the one that basically has funding for Medicaid. And as in previous presentations, with the adoption of the Affordable Care Act, then it authorized the formation of Indian managed care entities. And so that's how this prospect of a MCO with the nation's council authorizing Naabik'iyati Development Corporation in partnership with Molina Healthcare Services then become the entity that will qualify to access the CMS funding. So it is a different pot of money, and it's we're able to access that with the adoption of the Affordable Care Act. With Honorable Amber Kanazba-Crotty's question, it's the basic, I guess, difference has been the concept of what is active enrollment and what is passive enrollment. And in our research, there are more than 40 states that use passive enrollment. And so that's where a person that's receiving Medicaid dollars are approached and say, would you like to participate in Molina Healthcare, the Nautani Development Corporation's managed care entity? Whereas active enrollment, it means all or nothing. You take everybody. So in this case, passive enrollment, the choice is with our Navajo people that receive Medicaid dollars. So in that respect, and in the prior discussions with the governor, she basically had said that, you know, the nation passes this particular legislation. She would abide by the wishes of the veto. Then I basically had conversation with the governor and said, we're not going to publicize the issue. We're just going to go for the override. And so that's where we're at, committee members. With the adoption of this override, then the vote will basically say to the governor, this is what the governing body of the Navajo Nation Council is saying. Allow Molina Healthcare and Nautani Development to have access to the CMS funding through the Indian Managed Care entity. I hope I'm clear in my response. Thank you.
Thank you. I don't have anybody else.
Speaker?
Yes,
It's Delegate Halona. I'm finally back on.
I'm Malona.
Yeah, I just wanted to make a quick comment on this legislation that in the way Nautani Development is proceeding. It's only going to be for the New Mexico side of the reservation until it gets going, and then we'll have to move over and let them start a new program for the rest of the east western half. So I just want all the delegates to know that. And Utah will have to come later.
Okay.
That's my comment. Thank you.
All right. Have anybody else on both sides?
Speaker,
Yes.
This is Vice Chair Smith.
Vice Chair Smith.
I don't think I got my answer to the question that I posed. What's the position with the state of New Mexico government? We're on just the legislation regarding the override, and the president's not on board with us. That's the question I have. Have we made any conversation with the governor? Has our lobbyists been in touch with them, with the governor? Because this is imperative that we do have that communication gap open. That's my question. And I'm frustrated because I was trying to vote for the consent. I was trying to vote for the rest of these other items that were on the agenda. and now I'm told that I'm not considered. So it seems like I'm absent, but it wasn't my fault. It's because of the system. So, Speaker, please address that accordingly. I did vote green. Thank you.
Vice Chair Smith. Unfortunately, there was technical difficulties. Trying to work to get every kink out. Question, Vice Chair Smith.
Speaker. I don't hear anything.
Hold on, we're conversating with Office of Legislative Counsel.
Well, thank you. Speaker, can you hear me?
Yes, hold on. Let me go to the next individual, and then I'll come back to Legislative Counsel. Honorable James.
Can you hear me, Speaker?
Yes, I can hear you.
Okay, just wanted to confirm to see if you can hear me. Thank you. My last vote, I tried saying red for Ms. Henderson.
Okay.
Thank you. Going back on mute.
Is that Rick James talking?
That's
Oh, Vince James.
No, it's Rick James.
Let me go to let me go to let me go to Barbara about the position statement.
Thank you. So my understanding is the question is whether the governor has to honor it, and also if the nation has gotten back any word from lobbyists about what the governor's position will be. So these are short answers from me. It is my understanding that the governor is not legally obliged to follow it, but she has, so she could do it without the nation's authorization, but she had, I guess, reached out to the nation to ask what their position would be. As far as whether the governor will honor it, given the president's opposing position, I am not the one to answer that. I don't work directly with the lobbyists, so I have to defer to somebody else. Thank you.
On another
Question of privilege, Speaker, Delegate Claudia.
The position statement of the nation right now, there is no official position statement that was passed just for the fact. But if this does get overridden, that's something that the Speaker's office can work together with Patty Williams. And what I can do is get information to Patty Williams to see if she can get a response by the time this goes to council. Madam Chair, Crotty, question of privilege.
Thank you, Speaker. So I need clarification with legislation 0367-19. My understanding that was the position of the Navajo Nation. Can I get clarification? Thank you.
0367-19. 0367-19. Madam Chair, Claudia, did you say 0367-19?
Yes, sir. That was the original legislation sponsored by Daniel So prior to this emergency legislation.
Oh, that was the one that was vetoed, right?
No, that was signed. The emergency legislation was
Oh,
vetoed.
okay, so this is the position statement from the nation regarding that was passed by Nabi.
What was the number again?
It's actually
0367-19.
But the resolution number is NABIJA -06-20. Let me have Tom explain that, Madam Chair Crowdy. Colleagues.
Madam Chair Quadri and members of the council, I believe the previous lobby resolution was supporting an effort by Molina. This legislation that you're trying to do the override on makes a request to the governor to expedite that request, that the Molina program. So it's a little bit different. It's not the same one. So that's the difference between the two. Mr. Speaker.
Oh, I'm sorry, it wasn't clear. I was asking if that was the position of Navajo Nation Council. The legislation 0397. My internet just went out, so I can't pull up that resolution. But the resolution that was passed by Nabi in January is at the position of the Navajo Nation.
Madam Chair Crowdy, we're still researching that. There is a difference between both of them, and Chairman So requested for the second one that was done back in March, one that ultimately got vetoed by the president. Again? Tom, go ahead again. And then I'll have Dan back it up. Not back it up, but just explain on the other portion.
Mr. Speaker, members of the council, the 067 legislation that became a resolution NABIJA-06-20 used the language to secure all necessary approvals for expeditiously launching the Naabik'iyati Development Corporation to the governor of the state of New Mexico. Now, Navajo Nation Council, the override is now writing in that you want to expedite it. So the language that's used on this side is a little bit different than the other one. It's a very slight difference, but it is a difference. Mr. Speaker.
Ms. Barbara?
Thank you, and thank you, Mr. Platero, for that explanation and the differences between them. Both the NABI resolution and the council resolution are the positions of the Navajo Nation. To an NC 164A, under that, statements of policy are to be approved by resolution by the appropriate standing committees and the Navajo Nation Council. Statements of policies are statements of positions. Both of those, and that applies to both the NABI resolution and the council resolution. Now, the council resolution was an emergency resolution. If you will read the whereas clauses, there are differences. The council resolution focuses on the need to move quickly because of COVID-19. The NABI resolution was more focused on supporting the Molina Natani team because of the advantages they would bring to Navajo people.
But like what
Okay, that, colleagues, is there anybody else? I don't have anybody else on this side as well. On legislation 0091-20. Any comments, questions, colleagues?
Speaker Damon?
Yes.
Okay, I'll just wait around then. Yeah.
If you could put your phones on mute, we can hear your conversation. It's pretty inappropriate. Speaker Damon, my colleague, on this important matter, I want to make sure, so the position statement stands with the NABI resolution, and the council resolution was asking for to move quickly because of the emergency. What I want to make clear, and if we could have a conversation about the position of Navajo Nation as a governing body, and then what happens if the president does not honor the position of the governing body. And I think we're getting to that point. If there's no movement to move forward with that NABI resolution back in January. So I want to ask that question from Legislative Council. If the president does not honor the position of the governing body, what are some steps that this council can take to work in a government-to-government capacity with the New Mexico governor regarding this instance and maybe future instance where the council, through thorough discussion, transparency, and debate, creates a position statement, but yet not being fully executed by the executive office.
Sorry, Dana was talking into her mic again.
I apologize. Old habits. Talking into my mic. So many instances are different. In this particular instance, I believe that the plan is if the veto is overridden, that council through the speaker's office will submit the overridden legislation to the official Navajo Nation government position to the governor, along with a letter. In other instances, when there's not such a clear path, it is uncharted territory as far as how you enforce upon the president to follow council's position statements. It is for him not to do that, of course, is stepping outside of the 3-branch process and the checks and balances. So I don't have a clear answer that I would like to talk to you, that I would like to share with you in open session. At some point in time, we could go into executive session, and I can discuss with you some of my thoughts along those lines. In this particular situation, I think that the way to handle it will be for the speaker's office to communicate directly with the governor.
Yeah.
Okay.
Thank you.
Wait, I would like to just add something. Speaker gave me permission. I just received, and I believe it was addressed to everyone, an email from the president's office concerning this legislation and the veto override. And now I will give this back to the speaker.
As indicated by Ms. Barbara, about 5 minutes ago, the president issued a memo dated today's date to members of the council. Just read out the first portion and explains his position is that we informed that the legislation number 91-20 is on NABI committee proposed agenda. The legislation attempts to override resolution CMA-14-20, which was previously vetoed. We write to respectfully request your support of the veto and not allow for the override. So, and it just explains his position on the override. So I think everybody has that, colleagues. That, I don't have anybody else on the board. Colleagues, this just, when this goes to council, this goes directly to a vote. Again, anybody else? Nobody. I don't have anybody on my phone. I have anybody at Jalissa's phone. That one once, one twice. Make sure that everybody's not a chance to speak. 3 times.
I'll be here all day tomorrow.
With that,
I'll see what I do.
with that. Go board, roll call.
Elmer Begay,
Elmer Begay votes green.
Honorable Elmer Begay votes green. K. Allen Begay,
Calvin Begay Jr. votes red for now.
Honorable K. Allen Begay Jr. votes red. Paul Begay,
Paul Begay.
Nathaniel Brown,
This is Delegate Nathaniel Brown. I vote green.
Honorable Nathaniel Brown votes green. Eugenia Charles Newton,
Delegate Charles Newton votes green.
Honorable Eugenia Charles Newton votes green. Amber Canespa Crotty, Herman M. Daniels Jr.,
This is Herman M. Daniels Jr. I vote red for now. I'm going to do some research tonight.
Honorable Herman M. Daniels Jr. votes red. Mark Freeland.
Freeland votes green, excuse me.
Honorable Mark Freeland votes green. Pernell Holona.
Helga Halona votes green.
Honorable Pernell Holona votes green. Jamie Henyo.
The color of my eyes, green.
Honorable Jamie Henyo votes green. Vince James.
Delegate Vince James votes green.
Honorable Vince James votes green. Rick Nez.
Delegate Nez votes green.
Honorable Rick Nez votes green. Carl Slater.
Green.
Honorable Carl Slater votes green. Raymond Smith.
Green.
Honorable Raymond Smith votes green. Wilson Stewart.
Wilson Stewart votes green.
Honorable Wilson Stewart votes green. Charlene So. Daniel So.
Daniel So votes green.
Honorable Daniel So votes green. Eugene So. Otto So.
Green.
Honorable Otto So votes green. Thomas Walker. Edison Wanika.
Green.
Honorable Edison Wanika votes green. Edmund Yossi. Jimmy Yellowhair.
Delegate Yellowhair votes green.
Honorable Jimmy Yellowhair votes green. Paul Begay green. Paul Begay.
Paul Begay votes red. Yeah.
Amber Crotty.
I'll vote green for now.
Okay. Amber Canespa Crotty votes green.
Hey, colleagues, 16 in favor, 3 opposed. Speaker not voting. That, colleagues, moving on down because there's no one here.
What was the vote again?
16 in favor, 3 opposed. Speaker not voting or chair not voting. Since there's no one here in the chambers, the coasts are to move on to the next agenda. Legislation 0057-20 can be referred to the next NABI. I don't know, can somebody motion that?
Motion to move to the next NABI.
Hold on. Yeah. Motion to move to the next NABI 0057-20. Is there a second?
Second, Vice Chair Smith.
Elbow Smith.
Speaker.
Going once, going twice.
Speaker David.
Yes.
This is Henio.
Yes.
Okay, on this, we open for debate on this.
Just move 57-20. I'm the sponsor. It's for LDA to update the plan of operation. So it's open to debate. Chairman Henio.
The reason why I was trying to add this wanted to add this to the consent agenda also, because it's a change in the plan of operation where you just overstrike manager and insert the word supervisor, program supervisor, and it's a pretty much simple legislation to me. That's why I wanted to add it to the consent agenda. But if you wish to move it, Speaker,
You're the sponsor. Thank you.
Okay. I just don't have anybody to.
Speaker.
Speaker. The next Nabi. We good?
Can you add 0039 to that? To the next, refer to the next agenda?
Honorable Lona, there's a motion to modify, to add 0030. 20 to the next to motion to with 57 to have I heard that the next time. Good. Good.
This is Herman M. Daniels. I vote green.
Honorable Herman M. Daniels Jr. votes green. Mark Freeland.
Freeland votes green. Thank you.
Honorable Mark Freeland votes green. Pernell Halona.
Halona votes green.
Honorable Pernell Halona votes green. Jamie Henyo.
Henyo votes green.
Honorable Jamie Henyo votes green. Vince James.
Delegate Vince James votes green.
Honorable Vince James votes green. Rick Nez.
Delegate Rick James Nez votes green.
Honorable Rick Nez votes green. Carl Slater. Carl Slater. Raymond Smith.
Green.
Honorable Raymond Smith votes green. Wilson Stewart.
Stewart votes green.
Honorable Wilson Stewart votes green. Charlene So. Daniel So.
Daniel So votes green.
Honorable Daniel So votes green. Eugene So.
Votes green. Votes
Honorable
green.
Eugene So votes green. Otto So.
Green.
Honorable Otto So votes green. Thomas Walker. Edison Winika.
Green.
Honorable Edison Winika votes green. Edmund Yazzie. Jimmy Yellowhair.
Green.
Honorable Jimmy Yellowhair votes green.
Honorable Slater. Are you still there? Oh. Talk now. 19 in favor, 0 opposed. Speaking on voting, motion carries to add those items onto the next agenda, moving them to the next agenda. Colleagues, we do have two more legislations on the 0048-20 and 0088-20. And I did ask respectfully, colleagues, if we could go until 5 o'clock. And the reason why is because there's about 15 members of staff, not only here in the chambers, but elsewhere, that it takes them about 30 minutes to wrap up everything after we close. And they still got to go home to get their stuff and be home by 8 o'clock in order for them to not violate the 8 p.m. curfew. Moving on down. Legislation
Speaker.
0048-20.
Speaker.
Yes.
This is Chairman Inyo.
Chairman Hino.
A motion to adjourn.
Second. Speaker, Chairman Nez, second.
There's a motion by Chairman Hino to adjourn.
Second by Vice Chair.
Second by Vice Chair Smith. That motion is at 5:02 p.m. Is there questions, comments?
Question, Speaker. This is Delegate Stewart.
Honorable Stewart, what's yours?
Okay, with those two legislations, then, do they still get put on tomorrow, or are they moved to the next NABI as well?
We'll move to the next NABI.
Okay, thank you.
That colleague's going once, going twice, going 3 times on adjournment, or, yeah, what's adjournment? Yes. All right, it's been a long day. Roll call.
Almer Begay.
Wait. Elmer McKay votes red.
Begay votes
Honorable
red.
Almer Begay votes red. Key Allen Begay.
Delegate Kealan Begay votes green.
Honorable Key Allen Begay votes green. Paul Begay.
Delegate Paul Begay votes green.
Honorable Paul Begay votes green. Nathaniel Brown.
Hello, Delegate Brown votes green.
Honorable Nathaniel Brown votes green. Eugenia Charles Newton.
Delegate Charles Newton votes green.
Honorable Eugenia Charles Newton votes green. Amber Knazba-Crotty.
Delegate Amber King.
Chair Crowdy, could you say that again? Kind of broke up. And Chair Crowdy. Next one.
Herman M. Daniels Jr.
In favor, green.
Honorable Herman M. Daniels votes green. Mark Freeland.
Freeland votes green. Thank you.
Honorable Mark Freeland votes green. Pernell Halona.
Halona votes green.
Honorable Pernell Halona votes green. Jamie Henyo.
Vote green. Thank you.
Honorable Jamie Henyo votes green. Vince James.
Delegate Vince James votes green.
Honorable Vince James votes green. Rick Nez.
Delegate Rick Nez votes green.
Honorable Rick Nez votes green. Carl Slater.
Delegate Slater votes green.
Honorable Carl Slater votes green. Raymond Smith.
Green.
Honorable Raymond Smith votes green. Wilson Stewart.
Stewart votes green.
Honorable Wilson Stewart votes green. Charlene So. Daniel So.
Delegate Daniel So votes red.
Honorable Daniel So votes red. Eugene So.
Votes red.
Honorable Eugene So votes red. Otoso.
Red.
Honorable
vote red.
Otoso votes red. Thomas Walker. Edison Winika.
Green.
Honorable Edison Winika votes green. Edmund
Which
Yancey.
delegate?
Jimmy Yellow Hair.
I vote red. Minister Prada.
Honorable Jimmy Yellow Hair votes red. Amber Canaspa Crotty.
Delegate Amber Crotty votes green.
Honorable Amber Canaspa Crotty votes green.
The vote of 15 in favor, 5 opposed, 0 not voting. Motion carries. We're now adjourned. Thank you, colleagues, for calling in, and thank you for taking the time to discuss some NABI items. Tomorrow, we are having our Navajo Nation Council special session. That does start at 10 a.m. I know that there will be a 8:30 call regarding NCI out of Gallup. So we're putting that together. That is tomorrow morning at 8:30. If that has not been sent out, make sure that that's sent out within the next hour. The call-in number and the agenda on there. So thank you, colleagues. Those are the only two I have right now.
Speaker, you didn't really record me all the way.